highly appreciated, and I've been getting a lot of positive feedbacks from our managing committee in AMC as well as all our respected members in AMC. So we are back again, and this time we are going to continue this year also. But this is a very important event because Maharashtra Medical Council elections are coming up very soon, and we are all geared up to take charge of Maharashtra Medical Council through our elected representatives. Before I take the initiatives further, as an honorary secretary, I'm Dr. Alok Modi. I'm the honorary secretary of AMC for the year 2026-27. I would humbly implore you, request you, and literally request all of you for only one thing. Please come out and vote. First thing is, please come out and cast your valuable vote. Very few people come out to cast your valuable vote. And please understand that this is our election, our association, and AMC has always stood by to support you in times of need. Unless we have our own candidates in the forefront in Maharashtra Medical Council, things will not be very good. So we have to realize the importance of our one precious vote and the amount of hard work AMC and our candidates are doing. I would be opening up the forum very soon for our candidates to give their two bits to all our respected members. And before I go ahead, it's a sheer pleasure and honor. I'm very pleased to pass the virtual dais to our Honorable President, Dr. Rajendra Nagarkatti. Sir is here on the dais virtually. We've started this year with a big bang, and I'm very honored and pleasure to work as a secretary under Dr. Rajendra Nagarkatti. Sir, a very warm welcome to you. I wish I could give you some physical flowers to welcome you because the CI Summit is something which has been a hallowed summit for the last year. So a virtual thank you to you and a very warm welcome to you. And can I hand over the dais to you for your
Thank you, Alok. Am I audible?
Yes, sir.
Yeah,
Yes,
very
very
much.
loud.
Yeah. Okay. Thank you. So, good afternoon, everyone, and a warm welcome to all of you and the respected faculty members, office bearers, and my colleagues. It is indeed a pleasure to welcome you all to this AMC program on AI and mobile training talks. Artificial intelligence is now entering our everyday medical practice, right from communication and teleconsultations to even OPD and even our academic work. So, as a progressive medical association, AMC has always been striving in staying current with the professional growth of the doctors. So, along with our regular academic, professional, and member supporting activities, AMC wishes to prepare its members for the future of medicine, which today is AI and machine learning. So, today's session is a part of that vision to sort of gear our members to the upcoming years of AI in medicine. I thank our Honorary Secretary, Dr. Alok Modi, who himself is a domain expert in AI, for initiating this particular workshop. We have been doing it last year also under the presidency of Dr. Rajiv Agarwal and Honorary Secretary Dr. Prashant Kerkar, and it was a huge success. So we are continuing it this year. So I wish to thank Alok for spearheading this particular webinar and also all the faculties today, particularly Dr. Subhashree Patil, Dr. Ritu Johari, and Dr. Vipul Chawda for consenting to be a part of this webinar and spare their valuable time for us to speak on these topics. I'm sure this will be an enriching and practical session for all of you. So before I end, I would just once again make an urgent plea to all of you that today itself, it has come in the newspapers in a big way that the Supreme Court has rejected the government's plea to have an ordinance against the elections, and that's a huge victory for us because AMC, I mean the MMC is our body and it is a democratic body, and we should have our say in it, and which the government was trying to take it away by having only nominated members. So this is a very important election where we can have our own members in the AMC in the MMC, and we have our candidates who are ready and who have been doing work all over Maharashtra. And so we wish all of you please come out in huge numbers on the 26th of April and vote in large numbers so that we can have our own MMC representation in the, AMC representation in the Maharashtra Medical Council. So with this, I hand over the mic back to Alok it forward. I wish to afford a warm welcome even to I can see Dr. Prashant Kerkar, Dr. Alok Notekar, Dr. Rajiv Agarwal, Dr. Neeraj Bijrani, Dr. Nilesh Nafde, Dr. Supriya Arwari, and all the entire faculties for being here today on this wonderful Tuesday afternoon. Thank you. Thank you.
Thank you, sir. That was phenomenal as usual. It's always a pleasure to see the smiling face of Dr. Nagarkatti, sir, and the words that he gives a lot of enthusiasm and encouragement to all of us. So thank you for your kind words. And I just want to say
Thank
one
you.
thing
Thank
before we go ahead. Abraham Lincoln, this is a very good thing that we learned in our school days from Mr. Lincoln, the past president of the United States. The government is of the people, for the people, and by the people. I think that applies here. These candidates are of us, by us, and for us. If we don't realize this, then we are wasting our time, and that realization will come if we go ahead and cast a valuable vote. So, with that in mind, I will be very pleased and honored to to ask one of our candidates, a person whom I know very well, with whom I've had a fantastic experience because I'm just following his footsteps. He was the secretary when I was a treasurer last year. So, Dr. Prashant, who's a very reputed surgeon in Mumbai area, and he's taking out time and standing up as a
Oncosurgeon.
very candidate who is really sincerely working very hard for AMC. So over to you, Prashant. Can we have a few bites from you?
Yeah, thank you so much, Dr.
Just a small
Nagarkatti and Dr.
introduction to you.
Alok.
I didn't introduce you because it's a very long introduction, so I thought I'll leave it to you.
No, I will also try to make it small because the main purpose of this webinar is to make our delegates have some insights into AI. And Alok has been doing a wonderful job for more than a year now, getting great faculty from all across the country and making sure that we have enriched programs to give to our members. So since this is the last week before the elections, I am very proud to represent AMC in this particular elections along with Dr. Nilesh Nafde. And the reason we are fighting these elections is to take the AMC philosophy and ideology forward. And it's a very simple philosophy and ideology, and that is to stand with our members at all possible times. We support anything and everything that is pro doctor, but importantly, we vehemently oppose anything that is against the doctors and the private medical practitioners across the state of Maharashtra. So what happens really is that we have about 2,15,000 members registered on the Maharashtra Medical Council portal, but not more than 25 to 30,000 vote. So government takes advantage of facts like this, saying that since none of the doctors are voting, why do have the elections? And they want to, and they have made it evident through their efforts in the Supreme Court that the government is not in support of the doctors. It wants nominations rather than a democratic election process. And we at AMC vehemently oppose it. And that is why we are ready to fight it even in the Supreme Court if the government tries to get such nominated MMC body in the state of Maharashtra. So I urge each and everyone who is on this platform at the moment, please make sure that your voice is heard. Please make sure that you turn out to vote, and along with you, you take another 50 people that you know to vote so that our voting percentage increases, our voice increases, and the government is forced to take note of us, saying that this is not a body which we can drown under our voice, but it's a body which will rather we will use, we will hear their voice and make sure that it's a participatory organization which will make sure that the regulations that come out of MMC, the policies that come out of MMC are always and always in favor of doctors. So that is one vehement, earnest request from the bottom of my heart. Please get out on the 26th of April to vote. Please vote for our AMC members because you know that AMC is a single body which always stands by its members. And over the course of the last more than 50 years, we have helped more than 1,500 members in medical legal cases and other hospital related issues to make sure that our members are always taken care of. Second most important thing, when you go to vote, you'll have 60 members on the ballot paper. This 60-member candidates are each fighting against each other to make sure that the top 9 go to the council. So this election is not about panels, but it is about a candidate versus candidate. And you can vote for one candidate or you can vote for 9. Your vote remains valid. Any vote more than 9 makes your vote invalid. So please vote for only those people you trust, those people you think are accountable, approachable, and are able to carry your voice to the MMC to make sure that MMC never does anything which is not pro-doctor. So you can vote for candidate number 25, that is me, and candidate number 33, that is Dr. Nilesh Nafde. And if you feel any other person who's good enough, who's accountable, who's approachable, and who will make sure that the doctor's voice is represented in the council, please do vote for them also. But my primary request would be to vote for AMC candidates, those who have decided to fight in the name of AMC, so that the AMC policy and the AMC ideology is taken forward. Thank you so much, Alok. Thank you, Dr. Nagarkatti. Over to you, Alok.
Thank you, Prashant. That was very nice. And that's the need of the hour, that we need to respect our AMC ethos and policies. To that level, can I request Dr. Nilesh Navre from Ratnagiri, who's our other candidate from AMC? Dr. Nilesh,
Alok,
could I request you to unmute?
Alok, I'll just come in here. We are actually at a meeting in Khamgaon. We are sitting with a group of doctors. So I just took the time to come out and talk on this webinar, but we are addressing a group of doctors here also. So I don't think he'll be able to join. You can take the meeting forward and maybe somewhere down the line, I'll ask him.
Whenever he's comfortable and free, he's most welcome to join us. Thank you very much, Prashant. That was really nice, and that really helps us and makes us think in the right direction. Before we move ahead with the main program and agenda for today, I see the past president, Dr. Rajiv Agarwal, is on the dais. Our immediate past president. Dr. Rajiv, can we request you to unmute yourself and...
Hello, everyone. Thank you, Dr. Rajendra Nagarkatti sir and Dr. Alok Modi sir, for giving us this opportunity to post our views for this MMC elections. AI workshop has been a hit in last year also during my tenure, and everyone appreciated the efforts of Dr. Alok and the entire team who delivered the talks. 26th April, now there is no confusion. Elections are there. And just as Dr. Prashant told, I also appeal to each one of you that please cast your valuable vote. There are 9 people whom you can vote. तो आपको जो लगता है कि भाई जो लोग एसोसिएशन के लिए काम करेंगे, मेडिकल फ्रेटर्निटी के लिए काम करेंगे, ऐसे लोग को आप वोट करो. I am also contesting. My serial number is 1. And there are other people also who are contesting with me in my panel. So I would appeal each one of you to please go in large numbers on 26, so that our voice is heard and we have a strong Maharashtra Medical Council where we can fight for your rights and we can fight for you, so that you can sit back, relax, and not be worried that there is no one in MMC. There has been an administrator for more than 3.5 years now. After 5 years, the elections were supposed to be there, but unfortunately now the elections are coming after almost 9.5 years. So we all need to vote, or I would earnestly appeal to each one of you कि आप लोग सब mobilize maximum people. When you're going, you mobilize 3 or 4 people in your car and mobilize others also to go. Check where your voting center is. In Mumbai, the voting center is at Santa Cruz and JJ Hospital, and in Thana, it is at one of the schools in Thana. तो आप चेक कर लीजिए लिंक्स पे कि आपका वोटिंग कहाँ पे है, and accordingly voting starts sharp 8 a.m. and it ends by 5 p.m. So please cast your valuable vote for all the deserving candidates, and thank you AMC for giving the platform. Thank you. That's all from my side. And I wish my best wishes to Prashant and Ninad also for these elections. Thank you.
Thank you, Dr. Rajiv. That was very nice, and thanks for your kind words. And I think now we can move ahead, and I'll wait for Dr. Nafde to join up the moment he's free. Let's move ahead with the main agenda for today.
We can continue with the lectures, and in between, I think he can join up.
Yes, definitely, sir. And our first faculty, Dr. Subhashree, is there. She is physically present and with a nice smile on her face. Before we start the initiative for today's agenda, we have some very lovely topics today, which I'm sure will be very useful to you. May I request Dr. Rajendra Tiwari, who will be introducing Dr. Subhashree Patil. Welcome, Dr. Rajendra Tiwari. It's a pleasure to be working with you in the same team for AMC. Dr. Rajendra Tiwari is our honorary treasurer for the year 2026-27, and he's a very well-known personality who doesn't need an introduction. But to just do the honors, he is the director of Shri Maternity Nursing Home in Dahanu, Palghar. He's been a secretary of POGS, Joint Treasurer IMA Maharashtra, Treasurer AMC Mumbai, ex-chairman AMSL, ex-joint secretary IMA, ex-joint secretary AMC, committee member of the medical legal cell of IMA and FOXY, committee member of IAE cell FOXY, Assistant Professor Vedant Medical College Palghar, and member of the Negligence Committee for Doctors Palghar. I think I can go on and on and on. He has multiple awards and multiple presentations and academic activities to his credit. And on a personal level, he's a very good, nice person, very good friend, and he's always very helpful to all his members.
Thank
So,
you.
Dr. Rajendra, a very warm welcome to you. And can I request you? And I see
Yeah.
that before we go ahead, Dr. Nafde is here. I can see
Yeah.
there. So, Dr. Nafde,
Yes,
very
yes,
warm welcome to you. Can we break
yes,
the cycle for 5 minutes and can we have your kind words, please?
yes. Thank
May
you
I
very much.
request personal
Yeah,
person?
I seek apologies for the people who are being stopped because I am being introduced and allowed to talk. Very, very sorry, but we are on a constant journey and we are likely to be out of range. Thank you very much for this opportunity. I want to tell everybody that I am a contestant for the MMC election. I am at candidate number 33, and I wish to tell everybody that please remember that this is an election, a do or die election, because out of the 9 candidates which are going to be elected from amongst the private practitioners, it is our responsibility to send people of very high moral character, people who have a very good vocabulary, people who have a good oratory, and people who have the gumption to very politely, with folded hands, but very firmly oppose government policies which are not in the interest of our doctors. For this, we need to send people who are not obliged by the government, who are not employees of the government, who are not contracted by the government, and who are not beneficiaries of a single government scheme, may it be MJPJY or Ayushman Bharat. Because if there is a doctor, even if he's in a private practice, but if he is receiving lakhs of rupees as payments, which they in Maharashtra language they call as Labharthi of Sarkari Yojana like MJPJY, then there is every possibility that he might be pressurized to toe the line of the government. You have to send people of very high moral character who don't have a single penny of receivable from the government and who are groomed in the AMC grill to know the medical legal issues and problems of practitioners, who have all the seniors of AMC at disposal to advise them at critical junctures whenever advice is required. So 2 of us, that is Dr. Prashant Kerkar and myself, are the appropriate candidates according to us and also according to the AMC. We seek your vote most humbly. We seek your vote on the 26th of April. Out of 210,000 registered practitioners of modern medicine, usually every year the election count, the people who cast votes number only up to 25 or 30,000. This time we need to make a history because the government is hell-bent on cancelling elections and nominating all government appointees in the MMC, which will be a doomsday scenario for all the practitioners in Maharashtra. Please, I earnestly request everybody to go on the 26th April Sunday and vote. And that's all I want to say. Thank you very much for giving me the opportunity. Thank you very much for patiently waiting. Thank you very much.
Okay, thank you, sir. Thank you, Dr. Alok. First of all, I want to say that Dr. Alok has most profound knowledge of AI, apart from being a good diabetologist and physician, and we get benefited by that knowledge many a times. Not only that, he has worked dedicatedly last time as a treasurer, and I am getting guidance from him to work this time as a treasurer. Now, first speaker today is a eminent diabetologist and physician, Dr. Supriya Patil, and she is a MBBS from GMC Nagpur. DNB, she has done DNB in General Medicine from Mumbai. She has done Diploma in Diabetology from HN Hospital, Mumbai. She is the Director of Diabetes and Wellness Clinic at Andheri, Mumbai. Honorary Consultant at various famous hospitals in Mumbai like Seven Hills Hospital, Criticare Hospital, Apollo Clinic, etc. And she has received many awards. I'll just quote few of them. Received Community Service Award, Diabetes India Award, American College of Physicians Award she received from RSSDI. And this award was for care about the patients in diabetes as well as contribution towards the diabetes education. Best Woman Diabetologist Award she has won once, and she has presented many papers in national as well as international journals. And she is now giving to enlighten us on using technology for social media marketing by doctors. Thank you, ma'am. Please go ahead and with your
Yeah,
topic.
Dr. Tiwari, just 1 second. Somehow I've lost her CV slide. Just give me a minute, please.
Yes, yes.
Not fair that her slide was not here. Just give me a minute, please. Yeah.
Sure, sir.
So So I'll impinge upon the audience here because it was there was some technical glitch. We have not been able to show her CV slide. So this is Dr. Subhashree Patil, who's a very good friend and who's practicing in Andheri, Mumbai. She is on the. I will just add a couple of things to her that she has had wonderful presentations and publications on national and international platforms. She's one of the most sought after diabetologists in Mumbai city, and she has a profound knowledge and research as well as one thing great about her is she gives a lot of time and attention to her patients in diabetes education and counseling, which is a big thing which very few doctors do and which makes a huge difference in the performance of a patient's outcome. So she has received multiple awards, the Best Women Diabetologist Award in RSSDI just last year itself, multiple national and international awards attached to 7 Hills, Criticare and Apollo clinics. With that, and it's a huge list, so Dr. Shubhashri, we would not do that because we'll end up eating into your presentation. So can I request you to come on the dais and we welcome you? And can we go ahead and start your presentation? I think I'll have to share your presentation. I think your presentation is visible.
From my end, is it possible?
No, I think, is it visible? Just tell me, is it visible? I think I've already started your presentation. It's not? Okay, just give me a minute. I'll start your presentation.
If you allow me to be a presenter, I can do it
No,
from my
then I'll
mail.
have to give you the host rights and take it back to you. It becomes a little complicated. Or I'll do that. Fine. I'll just give you the host rights and you need to hand it back to me. Just give me a minute. Okay, you're the host now, so you can do it. And I apologize for the glitch over there. There was a little technical glitch here. So please go ahead.
I can do it from my mail.
Okay, so can you put it in presentation mode, please? Yeah, that's it. Yeah, it's visible.
My screen visible,
so over to you, Dr.
Alok.
Shubhashri.
Yeah.
Over
Thank
to you,
you
Dr.
so much for
Shubhashri, and
kind
welcome.
introduction. Yeah. Thank you so much for that kind introduction, Dr. Alok. It's truly an honor, pleasure, and privilege to be speaking on this forum in front of the esteemed audience like you all. And the topic that has been given today to me is a very, very interesting topic and very relevant to all of us in our practice. The topic today is the role of social media in health. Social media, as we all know, has become an integral part of healthcare landscape, and it is offering both opportunities as well as challenges for us as doctors. So in this presentation, we will explore the do's and don'ts of social media use, as well as the benefits it can provide for professional development and patient engagement. And we will also discuss about AI, that is, how AI algorithms can shape healthcare content on social media in our year 2026. Let's first start by discussing a case scenario. And we all know that in our day-to-day OPD, certain patients, management of certain patients can be challenging. And sometimes social media can add to our woes when it comes to having certain litigations coming to us. So a 62-year-old male patient walks into the OPD of a consultant diabetologist at around 9 a.m. in the morning as a first patient for consultation. There is history of type 2 diabetes, hypertension, IHD, patient has a chronic kidney disease, the compromised eGFR of 70, HbA1c of 8.5. Patient is taking glimepiride 2 mg, metformin 1 gram, statins, blood thinners, a usual diabetes patient that walks into OPD with uncontrolled blood sugars. The patient thereon, because the patient was already on a combination therapy, another couple of medicines were added by diabetologists, including sitagliptin and a dapagliflozin, for getting a better diabetes control. Genital hygiene, as usual, was explained to the patient, and patient was asked to follow up with fresh sugar as well as urine report subsequently 30 days after consultation. But unfortunately, in the 30 days, the patient got admitted to the hospital with a history of fever and a UTI. CT scan showed a benign prostatic hypertrophy. There was a renal calculus with left-sided emphysematous pyelonephritis. Patient was not settling. After a urology intervention of BJ stenting and conservative management, finally the urologist had to take a call on doing a nephrectomy. Post-operatively, this patient goes into sepsis, ARDS, and expires. The patient's son Googles why this has happened to his father and understands that it was because of the side effect of SGLT2 inhibitor that the patient developed a urinary tract infection. And grieved that the medication has been started by diabetologist, he decides to avenge the father's death by pulling the doctor across. So what he does is he approaches a social media person, a television and a media person to teach doctor a lesson, with an intention of revenge and defamation. And he feels that it was the doctor's negligence that has led to this urinary tract infection and subsequent sequence of event, which unfortunately culminated into death of his father. Now, this social media person contacts the treating doctor and asks for an interview appointment. Most of the time, we all know that doctors are soft targets for all of for the media and people, those who don't understand science, those who don't understand the medical theory behind any treatment. So here the doctor feels that probably he will be able to explain the good intentions with which he started to treat the patient, and he tries to make the interviewer explain how things went. So here, a typical social media verdict happens, social media exchange happens between the social media person and the doctor. Whereas the social media interviewer asks the doctor, you started treatment for this patient with this particular medication, which is known to have a urinary tract infection. So did you check the previous files and history of this patient before starting the medication? Why did you start this particular medication for this patient? Wherein the doctor explained that this is a very good medicine. It has been shown to be cardioprotective. And yes, we do explain genital hygiene and there is a possibility of urinary infection. So, but this possible side effect is explained to the patient. And we ask the patient to take adequate. Here, the social media person says, doctor, did you check the previous files of the patient and did you get a sonography done for this patient? Because this patient happened to also have a history of UTI in the past and the patient had a kidney stone in the past. Did you go through the sonography reports of past few years? The doctor says that, see, it was not mandatory to do a fresh sonography report before starting the medication. But that time the patient did not carry the previous files, so I have not seen it. So she says, that means, doctor, you have not done your job adequately well. You should have checked the previous papers of the patient. You should have made sure to, before starting the medication, to ascertain whether the patient would face this kind of side effects. So the doctor says, no, I have checked the reports and there is no such indication also to fresh sonography reports or anything before starting the medication. And I have been writing this medication very, very often. I have been doing this as medicine has been doing good to my patients. Here, the interviewer says that, see, look, doctor, I have got a previous picture of you. A previous night, you are enjoying yourself with your friends, carrying a glass of drink in your hand. So probably the day you consulted this patient, you had this so-called CME a day prior wherein you got drunk and you were under influence of alcohol when you started treating the patient. And that's the reason why you were not able to do the judgment correctly. Neither you saw the papers properly and you selected this medication to be given. And unfortunately, because of this medication, this son has lost his father. And it is you who is responsible. You have been under influence of alcohol, a hangover probably, and that is the reason why this is all culminated into. Here the doctor becomes defensive because he cannot deny a picture being put on a social media in so-called CME. He says that no, I was perfectly under control, but there is no way to prove it to people who are anyways looking as a doctor who is a villain over here who has led to a death of a certain patient because of his negligence. Now this becomes a difficult situation and this probably situation going wrong probably is led by that one picture which has been put on the social media. Here the doctor says that because of me, I've saved life of so many patients and this is one unfortunate event on the basis of which you are judging me. And here the journalist ends up saying that gives you a certificate of, because you have saved so many lives, does that give you a certificate of killing this one particular patient? So here you are being declared as a killer, a villain, a person who is of wrong judgment, practicing under the influence of alcohol, and all this just because of a single social media picture wherein you are holding a glass of alcohol in your hand. And that is what the social media can do to the age. So all of us as treating doctors should know how to use social media correctly. And that's what makes this presentation more relevant to all of us. Then how do we build a social media and an online presence? We can definitely use social media to our benefit, but at the same time, we should be aware about the laws of social media. We should be aware about what the rights and the wrongs over here. And that is what we are going to discuss. We should all create a professional profile. We should establish a consistent professional online presence, but it should be in right platforms like LinkedIn, Twitter, and Instagram. We should share always a relevant content. We have to always keep in mind that anything which goes in social media stays there for ages. So before we put anything in social media, we need to be very cautious as to what are we giving over there. So the content that we are putting in should be curated, created. It should be educational, informative, and engaging content, and it should position you as an expert in your field. Interact with your followers. Yes, we should interact with the followers, but we should keep us within the bounded by the limits of medical practice. Leveraging social media for professional development. Yes, it helps us leverage. It helps us connect with our peers, professional groups, thought leaders, engage in discussions, and we can stay up to date with the help of social media. Showcase expertise. Yes, it gives you an opportunity to share your knowledge, insight, blogs, posts, video tutorials, and speaker engagements to build your reputation. You can explore new opportunities in the form of discovering new jobs, speaking engagements, various collaboration opportunities can come our way. So definitely we can leverage social media for our professional development. One thing that we all need to keep in our mind is we should protect the patient privacy and confidentiality. We should avoid identifying the patients, never share any information that can potentially identify a patient, like name, age, or medical details. We have to respect the boundaries, not to engage in personal medical discussions on the social media. We have to comply with the regulations of HIPAA and other relevant laws to ensure that we are not violating patient privacy and confidentiality. You have to maintain professionalism. Separate your personal and professional social media accounts to ensure online conduct aligns with your medical ethics. Healthcare marketing. Should we market ourselves as healthcare professionals? Yes. We have to embrace data-driven marketing strategies to reach and engage patients more effectively. From telehealth options to digital, personalized digital experiences, these statistics show the landscape of healthcare marketing. Consumer expect digital experience. All know that our patients definitely look at our Google reviews. They see if you're accessible and easily accessible by booking an online appointment. Various portals and mobile apps are giving your visibility to the patient. And now the patients do expect you to be reachable online. So various digital portals allow consumer to access medical records, communicate with the providers, manage their healthcare on the go, and they do like it. Mobile apps are becoming more and more popular among the patients. So patients rely on online reviews. About 92% of the patients read online reviews before selecting a healthcare providers. So making review a crucial factor in decision. Healthcare organizers need to be actively managing their online reputation by monitoring and responding to the patient reviews. Online reviews provide valuable feedback that can help healthcare providers to improve their services and patient experience. Business operation management. Omnichannel marketing is essential. It should have a website, an email ID, a social media account, and mobile. So all these things are comprehensively going to create an online marketing channel for all of us. Healthcare marketing trends in 2026 are evolving, and AI-driven personalization, video content, omnichannel engagement, is going to help in trust building through reputation management, education content, local SEO. So all of us should indulge in this. The key over here is maintaining the data privacy. Self-scheduling tool will enhance the patient experiences. 2026 trends, of course, we are going to look more and more people using Facebook, Insta, YouTube, and LinkedIn to have access or choose their doctors. So our presence in all these forums, all these mediums are going to be equally important to create a good patient base or an image in front of our patients. Should doctors invest on social media marketing? Social media is an essential part of millions of people. How many people are holding a phone in their hand and they will every day have an access to various kinds of information? If we look at the statistics, as per the digital 2026 essential headlines, we are seeing that now the total population of 8.25 billions, 58.6% are on the social media. They are the unique users are going on increasing. Internet users are going on increasing. Active social media use is happening, and it is also on an increasing trend. So if it is on an increasing trend, then we should be a part of this evolution, and our presence also on social media becomes equally important to have an access to more number of people. The survey tells us that patients are using social media to look for health information. 9 out of 10 patients are looking at internet for their health information. 3 out of 4 have done so in last month itself. So patients are using these networks for peer-to-peer healthcare. They are increasing online social networks to connect with other patients. So, our diabetic patients may want to join a various other diabetic patients groups to understand the condition of their diabetes, whether they're doing good, whether they can get any more guidance from the patients who are just like them, are going through the same issues on day-to-day life. So they want to connect with the other patients through the social media networks. Online healthcare information resources push information out to the patient. So when we are putting the information and that information is getting passed on to so many patients, people who may be relevant and the right people to get the information to us. Social media, for example, we see so many of the Healthify app, Pitterfly apps. So why are these apps working towards obesity and they are so successful? They are successful because they are having great social media marketing behind them. What they are using are many key places where they are marketing or advertising themselves. Through these apps, they are trying to bring in behavioral changes. They are using various techniques to emphasize on the physical activity, and healthy eating habit, dietary intake. They are monitoring various indices of the patient. So the whole health industry is now focusing these apps and to reach out to right people. So if they are doing it, why as doctors should we be on the back foot? We should also be on a front foot and target our patient base correctly. As per the survey of 485 physicians, 58% responded to positively view social media as a main factor in their usefulness and ease of use. So why are we talking about patients? Aren't we as doctors learning from social media? Yes, we are. We are also watching various social media videos, social media content to understand more about our specialty or probably get some more information about other specialties. So even doctors are using social media for their upliftment. What are the uses that a professional like us that can that is you that is that we are looking at when we look at social media? We are trying to see to it that we get healthcare news through social media, some certified activities. We can get information through of medical conferences, clinical data trials. We can network with our peers. We say we can assess dosing and treatment information, learn from various patient cases, clinical discussions, and various virtual journal clubs are also helping us teach and get the right information. So social media not only plays a in the life of our patients, but also now plays a key in our lives as doctors. Physician can use social media for providing diabetes information. So I, being a diabetologist, I may give the right information to social media on how to check the blood sugar levels, how to keep the sugars under control. And that educational material will reach the relevant people and may increase the patient following at my clinic. So this becomes an important thing for me. Now, why is it important for us to disseminate this kind of information? Now, let's admit the fact that an average person with diabetes spends than 0.1% of their time in the whole year discussing their health matter with a medical professional. If you are spending that less amount of time, how much are we going to be able to educate our patients on diabetes in that limited period of time or in our consulting group? Definitely, a diabetes patient will have to look at various other sources to get the health information on various other topics that are bothering you. So, although the formal education is happening, but the amount of formal education that our healthcare team, our diabetes educators are able to provide them may not be enough for the patients. Definitely, for the informal education, they are engaging in various other health resources and tools. So if they come from the right channel, like if that comes from us, probably that gives us a leverage for any other person who is probably disseminating wrong information to them. So a diabetes patient definitely needs the help of social media when it comes to their diabetes management. What is the importance of social media for doctors now? For doctors, it increases online presence, patient engagement, public health information, professional networking, telemedicine, and brand building. But what are the guidelines that we need in mind when we indulge in social media? The National Medical Commission in India has established clear rules of how a registered medical practitioner should conduct themselves on social media, with a strong focus on ethics, professionalism, patient privacy, and truthful communication. These guidelines are part of IMP Professional Conduct Regulation 2023 and remain relevant in 2026 as well. We can all go through these guidelines when we are indulging in social. Now, let's look at some times when the things go untoward and a doctor falls into a case probably trapped because of the social media use, but not in the right manner. So there was a TikTok controversy in Gujarat wherein a Gujarat doctor was suspended after posting a video on TikTok that showed him mimicking and mocking his patient. The video was widely criticized for being unprofessional and it violated the dignity of the patient. This incident led to a review of social media conduct among medical sources. Same thing happened with a Kerala doctor. A Kerala doctor faced disciplinary action after sharing a patient medical condition on social media without the consent of the patient. That incident sparked a debate on patient confidentiality, ethical use of social media. Now, another case like this, that a doctor in Bangalore was reprimanded by the medical board for posting misleading information about COVID-19 treatments on Facebook. The post included unverified claims and recommended that were not in the line with medical guidelines. So these are the potential places wherein a doctor can lead to public confusion and potential harm. And these are the places wherein one needs to be very cautious while posting on the social media. Now, here is why still a doctor should consider investing in social media marketing. Because how would a newly practicing doctor, how would their patients know that what is the doctor, whether the doctor is available? How is the doctor going to show the visibility? So social media is something that is definitely going to help the doctor build the trust, engage the patients. Professional networking can happen, reputation management can happen, and it also doctor updated, and that is the reason why social media marketing should be considered by the doctor by keeping all the rules and regulations in mind. Now we will come at the last segment, that is how AI algorithms are going to shape the healthcare contents on the social media. As we all know that AI is the future and it is here to stay for years together. It is always better that we evolve and upgrade ourselves as per the AI and stay updated with this technology so that we are able to use it to our benefit as treating doctors. We should use social media with the help of AI algorithms to get personalized content delivery. AI algorithms will analyze user behavior, deliver customized healthcare content based on interest, health conditions, and search history. Targeted ads can be AI will help healthcare brands creating highly targeted social media ads. It ensures that the right message reaches the right audience at the right time. So if a doctor is searching for a diabetologist in my vicinity, probably they will start seeing the ads or the reels made by diabetologists on disseminating the health information on various social media platforms. And that's where the person can get attracted to a particular doctor who is talking about the same topic that the patient is interested in. Content curation. AI tools curate relevant healthcare articles, blogs, and videos promoting content that aligns with users' health interests and needs. Predictive analytics. AI can predict the trending healthcare topics or emerging healthcare crises. It is guiding social media content creation and public campaigns. Engagement optimization. AI optimized posting times, content formats, the post करे when the visibility will be maximum, the interaction will be maximum, and the patient footfall eventually would increase to your clinic when we are using this kind of tools. Ethical content monitoring, AI can also tell you that this content may not be completely accurate, the credibility may not be correct. So these are few things even AI can flag harmful health content to us. So it will completely guide us that what would be the relevant content, how we can make it ethical, and how we can make it reach other patients or the people who may we want it to reach. Last, what are the dangers of social media? Social media, no matter how good it can be for the doctors, but definitely it is one of the tools that can still end up disseminating poor quality of information. It can damage to professional image. One such incident is something that I started by telling that a single picture which has been put on the social media comes off damage the professional image of a doctor who has been working hard so many years, practicing ethically so many years, has been tainted and painted in a very bad light by just that one picture on social media. It can lead to violation of patient and healthcare boundaries. There could be licensing issues and breach of patient privacy at times from the doctor's end as well. So, all what I would like to say is that social media is one of the that we as doctors have got in our opinion, market ourselves correctly, make sure that our practice increases, all increases, and we and curate content that is more relevant and more ethical the- from our professional image point of view. But at the same time, some amount of caution need to be executed while disseminating this kind of information to the patients. And if we follow the NMC rules correctly, this one tool can definitely help us with that practice. Thank you so much for your patience.
Dr. Subhashree, sorry to disturb you. Can you get the mic a little closer? Part of your voice is going. It was going very well. I think the last 3 minutes we are not able to hear you.
Oh, all right. Do you want me to see the conclusion once
No, no,
again,
no,
Doctor?
it's fine. No, it's fine. No, it's fine. Just we could
All
just
right.
keep
So
your
I'm on my,
mic a
yeah,
little
I'm on
closer.
my last slide, Dr. Alok.
Yeah. Sure,
Yeah,
sure.
yeah.
No,
So
just we could not hear your voice. That's why I called. No
oh, all
issues.
right, no problem. So all I want to
Take
say
your time.
is
We
I
have
have
time.
concluded my social media presentation by stating that social media is a great tool for us as doctors. If we are able to maintain the quality of information, create and curate the content correctly, probably we will definitely be able to use it to build our practice. At the same time, we have to make sure that we play it with caution and in the right way so that we don't end up landing with any medical legal hassles. Thank you so much.
Thank you. That was phenomenal. Just a second here. I'll just take my host rights back to me. I'll take what belongs to me back. I reclaim myself as a host. Thank you very much, Dr. Subhashree. And just a minute, please, before I go ahead. Just give me a minute. Yeah. So I just wanted to share this banner before we move ahead, and I hope my banner is visible here.
Yes.
So yes. So Dr. Subhashree, what you have done is a fantastic job. I mean, it's always been a pleasure to listen to you. You have covered a full workshop. There are workshops which run for 2 to 3 days. I don't know how you managed it, but you covered everything so beautifully and nicely. You've literally covered the entire social media, the legalities, the advantages of having a social media presence. How do you do it? How does AI does it? Because that's where my heart flows. When you talk of AI. So it was covered very well, and it's not a surprise, and that's the reason I insisted. She has a very tight schedule, and I requested her to first come over and bless us. And then I'm very grateful to you that you could come over and talk about something which is so
Thank you
wonderful,
so
and you
much.
covered it
Thank
very
you,
well.
Dr. Alok, in fact, for giving the opportunity at this wonderful. Thanks.
And before we go, I can see a couple of hands from the attendees. I would request all of you to please participate in the panel discussion. I would take all the questions during the panel discussion. So I would request all the faculties to stay back for a very engaging and a very nice panel discussion. A personal thank you to you, Dr. Subhashree, because just have a look at your WhatsApp. And now we move ahead for the next meeting today. The next topic on the agenda today, sorry. And to do that, we have our Shahrukh Khan, our शेरो शायरी की जो आबादी जो हमारे एएमसी में बहती रहती है, जिसकी वजह से हमारे चेहरे पे मुस्कान आ जाती है. And who else could it be but one of the most reputed gynecologists from Bhiwandi Thane area, and you can see her smiling, and she's always in a scrub. She's working 24 by 7. her husband is a physician. I wonder, I mean, I need to talk to him. Whenever I see her, she's just working all the time. So welcome, Dr. Supriya. It's a pleasure and honor to have you on the dais. And I don't think you need an introduction, but I'll do the formalities. So Dr. Supriya Arwari has been climbing up very nicely. She's one of the most sought after gynecs and a friend and a member serving a lot of societies. She is currently the Joint Secretary of Association of Medical Consultants of Mumbai, and she was very nice and helpful to me when she was the Joint Treasurer with me as Treasurer last year. She is currently also the Chairperson of the FOXY Adolescent Health Committee, which is Federation of Obstetrics and Gynecological Societies in the apex national body of gynecology. She was also a committee member and she got selected unopposed. So that's something great and congratulations to you. She's been the recipient of the AMUKS Award, First Tree Award for the hands at the hands of the then Honorable Governor Shri Bhagat Singh Koshyari ji. She has also received the Dr. Anandibai Joshi Award for Meritorious Service by Female Practitioners in the Bhiwandi Nizampur Municipal Corporation. So, Dr. Supriya, I'm sorry, I'll stop here because your awards are huge, endless. And can we have the honor of you introducing our next faculty, that is Dr. Ritu Johari. Once you talk about Ritu, I'll talk about Ritu after that. So
Yes,
just a minute here and let me get her. Last time there was a big glitch and I could not play the introductory slide of Dr. Subhashree. I hope it clicks on the
you
right
can
page.
start
Yeah,
with
there you go.
the slide. Meanwhile, I will start with my शायरी कि
Yeah, please,
दुनिया में
please.
अनमोल रतन गिन चुन के बनाए हैं,
Hmm.
दुनिया में अनमोल रतन गिन चुन के बनाए हैं, उसमें से कुछ खास रतन आज हमारे बीच में आए हैं. So warm welcome to all our faculties and particularly to Dr. Ritu Johari, whom I am going to introduce. But before we move ahead with the faculty, let me say, madam, that one of the best Johari ka jo best, your Johari, so you know the nazar ek रहती है jeweler की, हाँ, जो अच्छे हीरे को तराशने की, one of the best हीरा is Dr. Alok Modi, who is our Secretary General now. He is one of the best hero in the world of AI that we can have, and we are blessed at AMC that he is on board, that he is hosting the webinar with us. So it's honor for us also. So Alok, congratulations and please keep up the good work. You are doing excellent work, and we are really proud of you. So now coming to our speaker for today, Dr. Ritu Johari. She's a consultant diabetologist and metabolic expert, Mumbai. MBBS and diabetology fellowship in India, consultant at Western Mumbai, co-founder of RFEC, which is the medical communication, medical writing, pharma, and healthcare services, founder of VIBE, that is Women Inspire, Build, and Enhance to foster women excellence, delivered many scientific sessions on diabetes and related products and on technology, several posters and papers to her credit, and successfully partnered never before launch of innovative technology, that is CGMs, in India. She has a vast experience in the area of using technology in diabetes, partnered with senior doctors in publishing for esteemed peer reviewed journals, honored fellow of Diabetes India in 2017, more than 17 plus years of experience. That's phenomenal experience. So madam, it's really an honor having you on board, and I would like to invite you on behalf of AMC, and please, you can start your session. We are really eager to hear from you. And she will
So
be
before
talking
we
about the use of technology, right, madam, in our medical practice, which is
Ma'am.
now coming in such a big way. So, madam, the floor is all yours.
Thank
before
you
we do
so
that,
much,
couple of
ma'am, for
things.
such a warm welcome.
Before we do that, Dr. Ritu, सुप्रिया, थैंक यू फॉर योर काइंड वर्ड्स एंड उसमें कोई आश्चर्य की बात नहीं, मेरी मुंह बोली बहन है तो मिठाई यदि चाहिए राखी पे तो उसको बोलना पड़ेगा. सो थैंक यू सुप्रिया फॉर योर काइंड वर्ड्स एंड माय वाइफ इज वेरी मच हियर एंड शी इज सुप्रिया तो बोलने ही वाली, तेरी तारीफ करने वाली, कभी जरा अल्पा की भी कर दिया करो, शी विल आल्सो बी हैप्पी. So one more thing before we go ahead, Dr. Subhashree has spoken very nicely about the social media presence. And if you want to see a live example of somebody who really puts it to task in a very nice way, you have Dr. Ritu Johari. You should see her posts. They are very enlightening and they are very, full of a lot of humor. And I really appreciate I don't know how she does it. These guys learn AI from me, but they don't teach me how they manage to work their social media handles so beautifully. So over to you, Dr. Ritu. And may I request you to upload your PowerPoint presentations? And her topic is a very important topic today. It's a very engaging topic. And I think this is very relevant today because she's going to talk about the role of technology in teleconsultation. Now, after COVID, we know that teleconsultation has become a prominent thing, and there are some ethos, do's, and don'ts which come with it. The doctors to the deceased Sushant Singh Rajput's uh, close friend has received a legal notice for not following certain norms of teleconsultation. So teleconsultation is not just picking up the phone and giving a consultation on WhatsApp, which anyway is barred by the Honorable Supreme Court. There are a lot of do's and don'ts, and there are a lot of ethos and pathos in this. So over to you, Dr. Ritu Johari, for this.
Thank you so much, Dr. Alok, and I completely second Dr. Supriya that a Johari knows where the actual Johars are. So I think so happy to have Dr. Alok amidst us and helping us all get on the boat aboard the boat of AI so beautifully. So thank you for this opportunity, Dr. Alok, as well as AMC and ma'am again for the wonderful words of appreciation. I'm going to talk on role of technology in teleconsultation as just a brief outline. What I'm going to cover is, of course, the landscape of teleconsultation, how it looks on the global stage, as well as what are the Indian data that is available. What is it that drives this technology? What are the various devices, the platforms? How does AI form a part of it? Then, of course, looking into chronic diabetes, disease management, and I'm obviously going to use diabetes as an example because that's my forte, but I will also put light on some other therapy areas where you can use teleconsultation as well. Then, of course, how this can impact clinical outcomes because anything and everything that you do, does it really give you a benefit on the terms of improving patient outcomes is the basic gist of it. And of course, there's going to always be challenges and ethics, like Dr. Alok mentioned, and then what the future has in hold for us in terms of the AI. So, just to give you a global landscape, we have, this is again from the diabetes perspective. The global telehealth market itself in 2030 is expected to raise by CAGR of 25.9%, which is to be, $455 billion market. And they are expecting that there is going to be a surge in the virtual visits. This was termed, this is entire study is during the COVID-19 times that they had said that 38% times will be a surge in the way the patients will visit the doctor. So as you know, COVID has taught us a lot of things. This is just one of the byproducts that people have made us more independent and medical access has become much more easier, even virtually. And then in patients who are willing to use teleconsult was found to be around 76% in this particular study. And 500 million plus teleconsultations actually happened on eSanjeevani India, which is a Indian government platform for virtual consultation. And if you look at key drivers that were responsible for this adoption of the teleconsultation during the COVID period, was of course, if you look at it, the smartphone penetration. I'm sure you all must have seen the reels talking about our government being able to send Paytms and the GPays of the world to even the small vendors like Pani Puri vendors, right, in India. And that itself gives us, the confidence that with the high-speed internet, with the smartphone penetration, it's easy for us to drive technology in such a country. Then, of course, the World Health Organization also put together a e-health strategy in 2018, which talked about, the footage and the foundation of planning e-Sanjeevani, which is the first Indian government platform for virtual consultation. And then 2020, the COVID-19 absolutely came in and knocked our door and said, hey, look, there is a lockdown and you can't go and see your doctor. But that's not possible that the patient goes unattended. So that's how teleconsultation becomes virtual, right? Teleconsultation becomes more as a mass adoption and global resource for each and every one. In 2022, we look at wearable integrations and AI triage tools that we will be looking upon in the future slides. And finally, 25 onwards, we're expecting to have multiple AIs, multimodal diagnosis platforms, and various other tools for you to use and enable your patients to get better care as well. Now, of course, like I said, because we're talking diabetes right now, being one of the lifestyle disorders that takes center stage, and just to clarify, generally a lot of times people say, "Why do you talk diabetes all the time?" And it's basically because diabetes is not the only disease, but the disorder that forms a basis for most of the issues today in our country as well as globally. So now, if we look at diabetes as a burden, there is 537 million people, adults living with diabetes worldwide as per the 2021 IDF Atlas. Then, if you look at the Indians with diabetes as per this atlas, it was 101 million. If you look at undiagnosed diabetics around the globe, that was around 213 million. And almost 1 in 2 Indians were absolutely having no clue about the fact that they have diabetes. And what are the general barriers that you see for these patients to seek diabetes care? Is, of course, the first thing being we know that we are a vast geography. We know we have rural and urban divides, where nowadays, on the contrary, as earlier beliefs, the rural actually dominates the scene, where you have 70% of rural population getting diabetes. Then we also have a shortage of doctors. We've been always talking about the doctor to patient ratio, which is still less considering the global standards. If you look at the out of pocket condition, definitely, yes, we keep hearing about this, that whenever there are launches of drugs or technologies, devices across the other countries, it's easier for them because the government funds them. Whereas in India, it's an out of pocket market. Every single person spends for his or her own medical benefit. Similarly, if you look at transport and mobility, again, an issue. Even in elderlies, it is very difficult for them because they don't have somebody who's a caretaker. They don't have people to transport them, especially if they have mobility issues beyond a particular age or if they have orthotic issues as well. Then, of course, this is also something that impacts the productivity, because most of the times, if somebody has to come visit a clinic, they have to take off from their routine work and come and visit the doctor's clinic. Similarly, these are the reasons that ultimately lead up the patients to lost to follow up, which means the patients try to but cannot make it on time for the follow ups, and that's what brings down their compliance, brings down their control, and ultimately brings down the overall productivity and the clinical outcome of the country as well. So technology fits into these gaps. So if you look at it, if the patient is around, he can anytime and anywhere access the doctor from any part of the country, from anywhere at any time, right? Of course, as per convenience of both. If you look at the monitoring as well, today we have the continuous glucose monitors. I'm sure you all must have seen the small white sized the Libres or the trackies of the world, where you can absolutely place a small device on the arm of the patient, and sitting remotely, you can monitor how many ups and downs the patient is having, or how good or bad is the overall glycemic profile of the patient. Exactly like that, you can also titrate the doses of the patient's drugs as well as insulin sitting remotely. And you can also offer digital prescriptions. You can give medication delivery. We have all the online pharmaceuticals available. People can get their medicine sitting at home as well. And of course, there are other WhatsApp based counselings as well that are available, and apps that I'm going to be about. So if you ecosystem, the entire ecosystem for diabetes, again, I'm just giving you an example, but this can be applied differently in all the therapy areas. So, of course, we're talking about remote monitoring, where, today, if you look at it, most of the patients, when you ask them, they have the BP monitors at home, they have the glucose monitors at home, they have the SpO2 monitors since COVID at home as well, and therefore, and the weight machines as well. So, if you want to check them, they are obviously going to be ready with all these readings, and then they can schedule a video consultation with their particular doctor. And through various platforms like the Zoom that we are using, or the Practo, or the Polo 247, and many more to mention, there are various ways that the patient can get connected with you on the video call. Similarly, there are chatbots that patients can get in touch with. There are various apps like the health apps, which is the Health Plagues, the Mfine, to Fly, where you can get through and get the patient talking to the doctors as well. You also have the wearables and the CGMs, like I told you, instead of just the remote monitoring doing personally, you also have the continuous glucose monitor, where you have the benefit of not being blinded, but this time you can absolutely see, which means the patient as well as both the doctors can see the glycemic profiles and can see their sugar levels and number times of the day, which means before every meal, after every meal, during every meal, you speak about it, and they can absolutely monitor their sugars in and out the day. And of course, there are various companies doing that as well. Then, if you talk about the M Health apps, again, like I said, there are a lot of them. So we can just, pick up one of them and guide the patients to lead those as well. And then we have the EMRs, or the electronic health records, and the data platforms that help us to not only, store their data, but also be able to revisit their older prescriptions and be able to guide them of how they have been doing in their journey over the period of time. Now, of course, like I said, if you look at the CGMs, which is going to give you the maximum information of the glycemic profile of the patient, how you can do is, while there are three different devices that we've mentioned here, but basically, every time that you're talking with a patient about the CGM, you can be sharing your screen and showing them exactly what these interpretations are about the graphs or the various types of reports that these devices offer. And that gives enough conversation points for the patients as well to understand their diabetes. And that's the major point, my friends, that once patients start understanding their diabetes, they are much better patients, they are more compliant, and they are more confident in taking their glucose level and in control to the next level. If you talk about the various health apps, like I told you, what do these apps actually do? So there are various things that they do. On the left hand side, they of course go ahead with logging the glucose reports, that how much the glucose is. They give up the medication reminders. So for elderlies, it's great because sometimes if there's nobody taking care of them at home and they're alone, then a simple phone reminder can help them to take the medicine on time. There is food and carb counting for those who do not know how to do the carb counting. So not only for type 1s, but type 2s as well, for uncontrolled, for brittle diabetes, for patients who are planning, pregnancies, or for patients who are planning cataract surgeries. All of this becomes very, very handy as a simple tool. Then, of course, tracking your activity as well. So, like, we count our steps. This also acts as everything under one roof. So you can have that. You can have a virtual coaching. You can also have the doctor-patient chat on these particular apps. Of course, the doctors are individually different on these apps. So you may be the one who decides along with your patient of which app is the best that they may want to be hooking upon onto. And if we look into anything and everything, see, we are talking about science here. Science always needs to be talking about evidence. Everything has to be evidence based because that's what builds trust. That's what talks about outcomes. So here, very clear, there is a great deal of evidence that shows almost 0.5% mean A1C reduction with app-based self-management, which is a meta-analysis done, not just one single study. This is from a meta-analysis done on 14 randomized controlled trials, which is, of course, a very reliable source. Medication adherence, like I told you, with all these features, of course, the compliance is much better. Adherence definitely improves with the reminder versus just being on the paper, because you can't expect your prescription to be put up on the fridge, and even if it is there, it's not easy for the patient to go to the fridge or the fridge to talk back that, hey, hello, it's your time for the medicine. So definitely, yes, there's been a 3-time better medication adherence as per the evidence that these RCTs talk about. If you look at the preference of the patients, of how they want to follow up over clinic visits, because when the patient is traveling to you, it's not only the time of the patient, but it's also the effort that they put in, the travel that they have to put in, the amount of economics that is involved when it comes to whether it's their car, it's somebody else's car, it's a cab, it's a rickshaw, or whatsoever, or the heat, the environment, a lot of other variables. But here we've seen 64% patients preferred the health online consultations as compared to the in-clinic visits, because now they understand that they have almost the similar conversation that they can have virtually what they could have had in person, and of course with the added benefits of the savings of the variables that I just spoke about. And then also 40% reduction in the diabetes related visits to the emergency room. And trust me, guys, this happens. So a lot of times we remember our patients used to reach the hospital only because they had a chest pain. Now that they understand how they have to manage their diabetes and what are the various things they need to do when they get such a symptom, it's easier for them to manage themselves at home and get in touch with you virtually as compared to running to you in person or to the ER. So, like I said, when it's about artificial intelligence, obviously we need to talk about transforming, the teleconsultation. How is this going to help in our teleconsultations? So, you look at predictive analytics. at the models talking about what's going to be your A1C in the future, looking at the CGM data. Imagine, to probably just assume and blindly suggest that, you know what, this is how your sugars are going, this is your A1C. Probably in the next 3 months, this is what I expect your A1C to be. But that's an assumption and that's not based on any mathematical calculations. Whereas here, you're absolutely getting predictive analytics, which are very, very well calculated and refined and reliable that are derived from the CGM data. Similarly, you can actually identify patients who are at risk of diabetic ketoacidosis, hypoglycemias, especially if the patients are fasting, like in Ramadan or in other any Hindu calendar fast as well. It's easier for you to guide the patients on how to plan their day during the fasting as well. The clinical decision making, that's again a very important thing when somebody is on insulin and needs very frequent titration. Now this becomes a very good tool because it is going to help you suggest that how much insulin is to be added, because while you give them the sliding scale, it's not easy for everyone to understand, oh, where does my figure fit and how much do I add or subtract. Here you are getting the suggestions directly from the AI base to understand and to be directly giving a direction to the patient that how much they have to take, so it's easier for them to follow instructions from someone who's reliable. Similarly, it can also help you in automated treatment protocol, adherence alerts, and a lot of other decision making for doctors as well. Talking about there is other things like retinal AI screening. We know that there is iSmart or Remedio, which has a smartphone fundus camera, so you can use that to early screen and detect the retinopathy as well. And just to bring to your notice, sometimes patients just walk into you, they have come in just for a regular checkup, and we found either retinal detachment in bilateral eyes in as young as 35-year-olds as well. So it is the time that we can prevent these sudden vision losses occurring due to retinal detachment kind of complications or diabetic retinopathy kind of complications with a 90% plus sensitivity. So definitely, yes, a teleconsultation with an ophthalmologist for the day will definitely be the next step. But do screen early is something that the AI can help you as well. Talking about documentation, again, like I told you, there is a lot of apps that give you transcription that help you in auto transcribing. So you, whenever you are having a call with your patient, it starts recording, and you can have that summary sent to the patient as well as keep it for your record as well, so that those notes become an important source for them for later perusal as well as for your record for later perusal as well. Similarly, you can use these for removing your previous records of the patient as well as to look at, when it's wound and foot AI, you can look at the foot-based diabetic foot ulcer grading. You can use the Wagner's classification via the smartphone camera. You can also do wound monitoring. A lot of times, the patients who are not able to reach your clinic because of the extensive wound and they're not on the legs and they're not able to walk and somebody has to carry them. Imagine the kind of immense confidence they will get when you can see their wound online clearly, guiding them, of course, with the amount of light that you would need and the kind of exposure of the wound that you need. And that will help them not only save their time, but their effort in reaching to your clinic, waiting period at your clinic, and also the tassel or hassle of thinking that how am I going to be reaching there, not only for the patient, but also for the caregiver. And then, of course, this improves compliance also indirectly. Then you also have chatbot triage, where you have 24/7 help for glucose queries, you have escalations, you have health literacy coaching in regional languages. So anything and everything that you're looking at artificial intelligence, yes, it can be done while for transforming teleconsultations. And then this is just basic workflow created for you to understand how this teleconsultation would be flowing digitally. So, at the pre-visit, the patient will book through your website or your app, whatever you like, as you have designed. And then there'll be an automated pre-visit questionnaire that the patient fills in, so that his entire, details, right from his symptoms to his entire labs that he may have done, or his any or any event that he may want to put up there is put up for you to see. Even the CGM upload data can be uploaded, and you can see it before the consultation with the patient as well. And of course, this will help the AI to pre-review flags and give you a clear look that what the patient has come with, what is the data looking like, and where the patient should be focusing upon, or where your conversation would be leading you towards. During the visit, of course, when you're doing the video consultation, the time could vary depending on the case that you're looking at. The physician would review the entire details that are giving in, but major, like I said, conversation would happen on the glycemic profiles. And of course, then talking about the dose titrations, prescription changes, and of course, the ambient scribe again takes up the notes and everything for you, which is happening automatically while you're talking to the patient. Post the visit, your digital prescription is ready. You can make changes manually, because I'm going to come up to that it's the AI. So of course you can always monitor the what the AI is giving you. And then of course you also can order the labs through that. You can put up the follow-up reminders for the patients, and you can also sync this to go and sit in the EHR for your later retrieval. And finally, of course, like I said, any and every glucose control needs monitoring. So CGM alerts monitored remotely. You can have nurses and coaches also glued up onto their day-to-day queries. You can have the AI flags also for different types of things like out of range, below range, above range, and you can also trigger the consultants as well. Then if you look at insulin management, again, that can be done as well as per protocol. You can have a remote way of looking at the insulin doses and their overall patterns and flags as raised by the AI with the logs that the patient has shared. And then finally, you can give them the dose adjustments, that how they have to manage their fastings or their post-lunch. And then accordingly, the digital prescription would be sent to the patient via the app or your particular website. Then, of course, if you look at remote screening for complications, that is another thing that we try to do, because complications is something that usually decide the morbidity in the patients with diabetes, whether it is retinopathy, it's the neuropathy, it's the nephropathy, it's the diabetic foot care, it's the cardiovascular status, or if even the sleep apnea. So all of these can absolutely be looked upon remotely via just basic trends and tools which have been mentioned here, which we can discuss in detail some other day as well. But if you look at beyond diabetes, like I said, when you're looking at diabetes, it takes center stage, but it is connected to the heart, it is connected to the kidney. So it's no more just something about the sugars. It is, of course, more about the organs that you're talking about. So how do we look at the heart? When you're looking at the heart, how is the blood pressure? So you can do not only the blood pressure monitoring, you can also have the ambulatory blood pressure monitoring and consult with the patients online, because that again helps them to not only see the reports of their blood pressure or how they've been faring over the 24 hours, but also gives them confidence that they can reach out to you right there and then. Then talking about, of course, implantable cardios, devices, remote weight and edema tracking. You can have the AGFR tracking. You can have the dialysis symptoms monitoring through calls. Thyroid also, you can look at the hormonal trends shared by the various labs as well nowadays. You can have the spirometry or the inhaler adherence apps. You can have telepsychiatry apps as well for diabetes distress, where you have a very clear note on what the patient's PHQ-9 talks about and how it's been going over the period of time. Like I mentioned, it's not only about the diabetes, it goes much more beyond diabetes when I talk about teleconsultation. So there are today possibilities of teleconsultations in dermatology, in oncology, in gynecology, in obstetrics, cardiology, as well as orthopedics. Because if you look at it, dermatology, yes, there has been image-based diagnosis, and I'm sure a lot of times you receive images from patients saying, "Doctor, I got this, what do I do about it?" So instead of getting those kind of messages, it is easy if you have a system in place for teleconsultation and you guide them there. So what happens is, not only does it help the patient to get their answer and understand that you are going to be available and going to be able to answer them, but also you get your due diligence done in terms of giving them an appropriate consultation rather than just giving them a casual WhatsApp response. So when it comes to AI assisted lesion screening, that is also possible. And there is, of course, high accuracy in terms of like the Wagner's. Even for these classifications, there's a very high accuracy that the AI is being able to provide us today. If you look at oncology, that's a very caring kind of a field where most of the times the patients are needing a lot of counseling and a lot of psychotherapy. And it is very difficult for them to come down to the hospital hospital, probably reach their counselors, wait in queues for their doctors or their counselors as well. Here, you're able to lead virtual follow-ups, symptom monitorings, treatment toxicity tracking, maybe multidisciplinary tumor board discussions with your 2-3 doctors or patients and their relatives in 2-3 cities. So a lot of things can be done sitting remotely as well, even in oncology. Talking of gynecology, of course, Supriya ma'am is here, but definitely when we talk about patients, PCOS, menstrual, fertility tracking apps, contraceptive counseling, reports and ultrasound reviews, if they want to share soft copies with you and you want to get back to them about something, especially when doctors are traveling. A lot of times we all have a very busy schedule, and it's very difficult for us to make up for the lost time of the patients when we are in conferences, when we are in transit, and the patients are trying to reach you. That is when, again, this remote teleconsultation comes to our rescue. Similarly, for obstetrics, in high case pregnancies or in patients who are not able to travel because they don't have somebody to bring the patient to you in their maybe the third trimester, then antenatal check-ins, the risk stratifications, remote monitoring of blood pressure, blood glucose, fetal monitoring, reduced hospital visits. All of these are the benefits of teleconsultations then. And then cardiology, of course, like I said, there can be remote ECGs, there can be variables for arrhythmia detection these days. You can do a lot of things with ABPM, and also BPN, heart failure monitoring as well can be done. For orthopedics, I know this is a little tricky, but I would still like to say that for a lot of patients who are maybe in situations where they may need more follow-ups, but it's difficult for them to reach the patient to the hospital or the clinic, this is where probably the patients can be at least under vigilance of the doctor through remote monitoring and be able to have a good rehab in terms of their physiotherapy period, rather than not coming and not following up in time. So that their imaging, also if they are doing imaging close to their house, and if the doctor is a little further away, at least they are reaching to the doctor in time if the issues are picked up. So different specialties, different tools, but one common goal through AI, which is extending expert care beyond the walls of the hospital or the clinic. Now, like Dr. Alok said, everything has to go through legal windows. And teleconsultation in India has, of course, also seen a lot of development. As I mentioned, there are various platforms, but the eSanjeevani has been a free platform by the government. Almost 500 million plus consults have happened over this. There's Apollo 247, there's Practo, you may have heard of, there's MFine. The Fortis and Manipal ones also do have their major teleconsultation platforms. Then, if you look at the regulatory milestones, like I said, the legal framework, 2020 was when the Ministry of Health and Welfare rolled out the telemedicine practice guidelines, which was the first ever time that they did so. And they also, because of the COVID brought out the National Telemedicine Service via ICMR so that it got legalized. In 21, there was the Disha Act that was brought out, which is the Digital Information Security in Healthcare Act, which is for data protection of the patients. And then in 22, you talk about the Ayushman Bharat Digital Mission, where you're now trying to link the health records as well. And then in 23, we have the NMC updates, telehealth curriculum for postgraduate trainings. And 24 saw the insurance regulatory, where the IRDAI mandated that the tele-OPD cover has to be covered in Arogya Sanjeevani as well. So that's how the overall legal framework looks for us in India, which is very, very promising. Now, if we talk about the clinical outcomes, like I said, everything has to be evidence-based. So these are the statistics, my dear friends. If you look at teleconsultation versus standard care, this is again from a publication in 2017. That was the latest. And then 2019 and 2022, two other papers that were found where we saw, almost a good amount of A1C reduction with telehealth. This does not mean telehealth replaces standard of care. It just means it comes to the aid of standard care, because in standard care, a lot of times you may have patient loss to follow up and compliance issues as well. Similarly, the BP control, you can see again, the greens are always more than the reds. The green is basically nothing but the telehealth, and the red is nothing but the standard care. So clearly, the teleconsultations are which are faring over the standard of care in terms of helping the patients to build on to the standard care that they are are taking from you, and thereby even virtually be able to manage their own health remotely. So if you look at the patient-centered digital care, how does it help? It not only brings in awareness or understanding of the disorder in patients, they are much more owning their disease now. They are able to be enrolled. So you can absolutely enroll the patient onto the platform that whatever you're using, you can onboard them with the device setup and everything. You can have them regularly check it so that they are actively using it and getting more confident about it. They're able to use it even when they're traveling remotely. And of course, that brings in the empowerment to live with their disease with much more confidence and live as normal a life as somebody without that chronic health disorder. So clearly, if we look at it, it's about the digital health literacy that we need to improve in these patients living with chronic health disorders. Whereas, when it comes to language barriers, we can use apps where there are, various different languages that are being launched, which removes the language barrier. We can have video tutorials for people who are using these kind of technologies like the CGM or the glucometer, so that they can use it even remotely if they're not able to talk to the doctor. Because sometimes it's not easy if they call you and ask you, oh, how do I use the device? So you have those videos which are ready in their local language for them to use and be able to apply. Similarly, peer support groups via WhatsApp, which is shared live experiences. So imagine if somebody is talking to the other person and sharing their overall experience. That gives another level of confidence to the patient in believing in the strategy that you're using to treat them. Similarly, there are a lot of apps that are using gamifications as reward points, like you have for credit cards. Now you have reward points even for these health apps, so that people are logging their glucose records, people are logging their exercises, they are putting in the photos of their diets that they are actually consuming, and therefore they're able to accept their disease much more and be able to work towards it much more. Similarly, you can also involve the family member within the teleconsult and also have them to help the compliance improvement in the elderlies. Talking quickly about challenges and barriers, of course, there's going to be technical challenges, whether it's the internet connectivity in rural India, it could be the device cost, the affordability, because we are an out of pocket market. There could be inoperability, platform issues. There could be data loss. Similarly, clinically, if you look at it, of course, we always feel that human touch is not there because we can't perform physical examination. There could be a miss of clinical science sometimes because of the lighting that you're seeing, or because of the visibility or the internet connectivity as well there. Then there could be under or over diagnosis risk, which you then of course need to underplay in your mind as well, or play in your mind as well. And then emergency situations where you still would want the patient to reach to a medical center. Regulatory challenges, of course, there are still liabilities that are unclear in AI driven decisions in terms of cross border prescriptions, especially in terms of various countries, because if somebody is in another country, how do you apply the rule on them as well? And licensing of course, becomes another issue. And then socioeconomic challenges where you have a digital divide, elderly versus illiterate patients, language barriers, distrust of technology, somebody who does not believe what AI is doing, not happy with your mode of conduct, and then, of course, the insurance reimbursement gaps as well. So definitely, yes, here I would just like to just say one line, wouldn't go into single points, that look, having informed consent. There's definitely no doubt that you would still need the consent of the patient if you are looking at AI usage, and if you're looking at it through teleconsultation, data security that you're using to store the data for the patients, algorithmic fairness, and of course, professional ethics while you're using this. Talking of quickly the future of teleconsultation, of course, there's lots within diabetes framework, and I'm sure a lot more beyond that as well. So with that, I think I would summarize saying that diabetes, of course, or any other chronic diseases are at an amplified rate growing today. And therefore, it's very important that if we have technologies like AI helping us to bridge the gap and improve the patient care, then that's what we should be using. Thank you so much.
Thank you very much, Dr. Ritu. They say that the fairer sex is superior to the male of the population. We had two fairer sexes today giving elaborate talks. I actually wonder, you guys call me good in AI. I wonder if you guys have done this from AI or this is your natural intelligence. Both the speakers have done a fantastic job. And Dr. Ritu, you as usual covered a very phenomenally long topic. And I had purposely given workshop type topics, but you covered it beautifully in half an hour. Fabulous. It was very nicely covered. Thank you very much for a wonderful presentation. Can I ask you to minimize your PowerPoint so that I could invite the next?
Close. I just remembered I had one closing line. Can I just use that? you know, because this is something that is, I'm sure, is going to be just one line. So you know,
Please
generally, whenever we have the AI and the human
But
brain,
then
it's the
Dr.
human brain versus the
Vipul, one second. Dr. Vipul Chawda is here. He said he'll sponsor a dinner and a coffee for them if you want to speak online. So that's between you guys, so go ahead.
done, Vipul, done. 2 dinners. 1 line, 2 dinners. So this is just about, you know, whenever we talk about AI, there's always this debate that heats up that, you know, human brain versus the AI, and people have this thing in their mind. They start looking at it as, you know, the fight between the human and the AI, but it's actually the human driving the AI. So I just want everybody to be adaptive and open to use AI rather than looking at it as a competition. It's always going to be the human brain driving the AI. That's it.
Thank you. That is something we always keep saying, that if you're not AI trained, the future is not that AI will replace doctors, but the future is that AI trained doctors will replace non-AI trained doctors. So I don't know how many of you are going to replace me tomorrow. So before we go ahead, something I want to show all of you, because this is very important, and I hope people take charge of this. Guys, don't forget 26th March is here. We need you guys to vote. Please come forward, and this is your own comment. This is your own Maharashtra Medical Council. You need to vote for people who are honest, integral, and who are reliable. First thing that I would request everybody, please come forward and cast your vote. Get out of your houses. Like we are working hard for the last few months, I'll say. There are a lot of dignitaries in our Association of Medical Consultants, Dr. Niranjan Agarwal, Dr. Sudhir Nayak, Dr. Subhashree, Dr. Sujata Rao, our own esteemed president, Dr. Rajendra Nagarkatti, Dr. Supriya Ravari, everybody is here. We are all slogging very hardly. I mean, very hard, sorry, not very hardly. I'm very sorry. Very hard to make sure that our candidates and our voice and our association gets a very proper and a fair representation in MMC. Don't forget that AMC has been working very hard, and AMC should get into MMC. With that in mind, please keep a tab on these candidates. Remember them when you come out on Saturday to cast your vote. Now, without taking much time, let me invite the next celebrated speaker. Unfortunately, I would not be having Dr. Nabar here today because he's had a medical emergency, so he's not there. So I would be happy to share the biodata of the next celebrated speaker. That's Dr. Vipul Chawda. Just give me a minute here. Dr. Vipul hails from Ahmedabad. He's a very good friend and an esteemed personality. I just need one clap on my back that I'm able to catch all the big shots to Mumbai, even on a virtual platform. And they're all ready and willing to come and help me out. So I'm really grateful to all the big shots at national level. With one phone call, they take out their precious time and they come and join us as an expert. So Dr. Vipul is a big name and he doesn't need an introduction. He's an FRCP from Edinburgh, FACP USA, postgraduate diploma in endocrinology from UNSW, chairman and founder of Rudraksh Institute of Medical Sciences, a very well-known renowned metabolic, diabetes and obesity specialist. He served our associations, our medical fraternity, multiple roles. He's been the treasurer of RSSDA Gujarat chapter, president of Indian Podiatric Association in Gujarat, national and regional faculty at CPS, cooperative member of ACP, AP and APG, president of DRIMI's charitable trust, huge amount of publications, presentations, authors and principal investigator, multiple awards including the USV Innovation Award in 2021, Times Group, Bharat Chikitsa Puraskar Award by the Government of India in 2022, as well as the ACP Award. I can go on and on, but then that will curtail on your time, Vipul Bhai. So Vipul Bhai, thank you for being here. It's a pleasure and honor. And may I humbly request you to grace the dais and shower us with your knowledge and presentation. And his topic is a very wonderful topic, and I've kept this topic because it is very relevant for today.
Thank you so much, Alok bhai. Let me share my screen and then I start speaking. So I hope
he's going to talk about he's going to talk about the role of artificial intelligence in OPD consultation. So finally, I've got AI insight. So there you are, Dr. Vipul.
Yeah. Thank you so much, Alok bhai, for this wonderful opportunity. Thank you so much, AMC, for allowing me to talk on very important topic in doctors' day-to-day life, that is OPD counseling. Metabolic, clinical and medical legal perspective in a modern medicine practice and how AI can help us. So we all know that medicine today is not just a doctor's only clinical knowledge part of it. Here, there is a knowledge which is augmented by AI, which is taking care of many aspects further. So AI is not here to replace doctor. Dr. Ritu has delivered a wonderful talk. She almost covered many part of the counseling in the teleconsultation, because any consultation require proper counseling. But we all know that the AI will refine the knowledge of the doctors who are practicing over here. So today I will focus on very practical question. How can AI transform OPD counseling, especially in metabolic disease, will help doctor in day-to-day practice? Briefly, I will cover AI landscape, OPD workflow, integration of AI, metabolic counseling, what are the medico-legal realities, and something about future direction of AI integrated OPD-based counseling. Ultimately, we all know that all AI and medical association definitely will increase the conversation and betterment of the conversation of doctor with their patients. AI in medical field operates in three major pillars. We can see in this slide, that is machine learning, NLP, and decision support. With machine learning, we can have a risk prediction for many diseases, including metabolic disease like diabetes, hypertension, and dyslipidemia. NLP can help in documentation and communication, and doctor can more focus on translating their knowledge to the patient and counseling the patient rather than doing a paperwork and entry in data into the computers. And in decision support, AI can help to filter all the possibilities and have best treatment guidance for their patients. A recent data shows over 80% of the physicians are already using AI tools in their capacity in their day-to-day practice. But are we using AI consciously or subconsciously? That is the choice that we have to make and we have to understand. Because uncontrolled AI, when we use it, can be dangerous for the doctors as well as for the patient, and that we all have to understand. Let's come to a real OPD setting. AI today is already doing many things. It is causing doing ambient scribing, EHR integration, risk calculator, chatbots, and lab analytics. We can understand that with the ambient scribing, they reduce 30 to 40% of clerical load of doctor. With EHR integration, we have instant access of many data whenever we want a patient's data, whether it's a recent time data or before 2 to 5 years old data. In diabetes, in CVD, we can have a good use of AI for risk calculators. In OPD, when there are multiple doctors are coming and patient is not aware where to go, there is pre-consult triage with the help of chatbot that helps patient to decide which doctor they should consult. And ultimately, there is a lab analytics and also have a trend prediction with the help of CGM and many other methodology for many other disease that can help. So what changes? Earlier, doctor was only a data collector and decision maker, but now with the help of EHR, the doctor is not only decision maker, but he is a better communicator with more filtered knowledge. And this is the time we have to understand the paradigm is shifting, and that's why we doctor have to integrate AI in many aspects of our practice. Let's start with the metabolic disease counseling. Metabolic disease are where AI creates maximum clinical impact, and we are seeing them in last 6 to 7 years. Let's take diabetes as an example disease. In diabetes, what AI can help? AI can help in diabetes with a predict glucose spike with the help of CGM and ML. Personalized treatment plan can be made with the help of AI for all your routine OPD patient, and reduce treatment inertia. Usually when patients are more in OPD, doctors are mentally fatigued, there is some burnout, and sometimes knowingly or unknowingly, there is a clinical inertia by the doctor. But when we use AI, there are more filtered outcome for the patient, and it reduces treatment inertia from the patient. Evidence suggests that AI-driven OPD improves glycemic control for the patient, improve adherence of the patient, as well as there is a long-term outcome that is also improving for the patients. Now, metabolic syndrome. Let's talk about all other hypertension, dyslipidemia, as well as the obesity into the consideration. When we do AI integration, we can have a better understanding of waste, lipid, BP, glucose, all of them into one, and we can have metabolic syndrome criteria the IDF has made, which can predict 10-year risk of developing any cardiovascular disease in the patient. Talking about obesity, in obesity counseling, AI can help to make proper diet and also track proper dieting. Calorie precision, also important part in obesity management, is a behavioral therapy, and AI is very important in deciding the behavioral therapy for the patient in day-to-day practice. AI, because a continuous coach is there is no episodic advisor. With the help of AI, patient can have continuous monitoring and continuous supervision that ultimately translate into better care of the patient. So key message here that we are moving from advice-based counseling to data-driven precision counseling, and that is what we require for our management of all our patients. Talking about cardiovascular and cardiometabolic disease, and the precision medicine, we can understand that traditional medicine is a reactive approach. Whenever patient gives some complaint, whenever we find something into the report, then and then we do something intervention to prevent that. But with the help of AI, traditional medicine, which is reactive, is replaced by AI-driven medicine, which is very predictive. AI can help to detect subclinical disease. AI can help to integrate variable data into routine practice. And there is a personalized therapy that can be useful for making decisions for betterment of the patient. Even pharmacogenomics is now entering OPD space. And this means that we are no longer treating disease, but now we are predicting the disease. And with that, we are preventing many future comorbidities as well as complication in our patient. One of the very important aspect in which AI can help in day-to-day OPD counseling is a mental health and psychosocial counseling. This is the biggest benefit for the patient when we use the AI for patient education in a better way. In this segment, AI can help to translate complex language into the simple that patient and relative can understand, provide multilingual counseling. Sometimes patient is coming from very far away and their mother or native language is very different, but with the help of AI, we can translate that and we can have multilingual counseling of the patient. And because of that, there can be improved adherence. Also important in mental health, when AI detects non-adherence, sometimes patient is not feeling well, but the root cause is non-adherence to the therapy. And with the help of AI, we can improve the adherence and thereby we can improve the outcome. The screen depression, it is possible for a mass population to use for screening of the depression for a patient in a mental health OPDs. And because metabolic disease is not just a biochemical disease, it's a behavioral disease. So all metabolic and mental health challenges can be utilized with the help of AI augmented practice to prevent the future complication. But here we have to understand the medico-legal framework for the patient whenever we are using AI for the use of counseling in the patients. It is very critical aspect of using of AI that who is responsible for any misconduct or any thing that happens which is not expected, whether AI or doctor. But of course, the answer is very clear. The doctor remains responsible. So doctor has to understand there are 5 non-negotiable facts whenever we are using AI for the management and counseling of the patient. First of all, we have to disclose that we are using AI for the betterment of the patient. But we have to explain the role of AI that helps us to gather the data, analyze the data, use the already stored data and predict a better plan of the management for the patient. Here we have to take informed consent of the patient. Also document AI output on your prescription pad or your letter pad, and also document override decision whenever we take some decision which is usually not taken, but for with the help of AI, when we are finding something is more important for the patient, we have to write down that. So ultimately, we have to understand there is one golden rule for that, that AI can assist decision making, but cannot not replace the accountability of the doctor. Also, we have to remember that there are some AI bias exist. No system is perfect, and it is constantly evolving thing. So which is right today may not be right tomorrow. So we have to understand that AI bias exists. Data privacy risk also exists. Doctor-patient relationship is a very confidential thing, but here there is some chance that there may be a data privacy risk. Legal frameworks are also evolving, so we have to be updated about the legal norms when we are using AI in day-to-day practice. And if you don't document, then you don't exist legally, and your practice can make you sit in a very legal format where you are very answerable for your misconduct. So we have to understand there are some limitations and there are some challenges that we use with the help of AI. That AI is powerful, but AI is not perfect. There are bias in the data set that we have to understand. There are some over reliance by the doctor on the AI, which should not be there. There are skill erosion. 88% of the concern is there because of that, and which is the biggest risk, that doctor became operator instead of thinker with the help of AI, which should not happen in day-to-day practice. So ultimately, I would say that the future of medical counseling or future of OPD in doctor is a hybrid model. AI can help in documentation, AI can help in risk scoring, and AI can help in monitoring. But doctor has to do the empathy part of the practice. They have to understand that judgment has to be taken by the doctor. There is complex decision making that has to be done in keeping patient and relative in confidence, and that part has to be done by doctor. So here we have to understand this is not AI versus doctor, but here is AI plus doctor, and they both are complementary to each other. So let me summarize by telling that AI is already integrated in OPD. If you are think that it is future, no, it is not future, it's a presence, and many clinics and many doctors are already empowered with the AI. Metabolic care benefits the most when we use AI in the management. Medical legal awareness is essential. Doctor remains central authority, and they are medical legally responsible, and ethics and equity are very critical when we are using AI in day-to-day practice. So AI is a tool that empowers doctor for better practice. AI is not a replacement for doctors. I will end with the one simple thought that AI can analyze the pattern, but only doctor can understand the people. And medicine is a still science of human, not machine. Once again, thank you so much, AMC. Thank you so much, Alok Bhai, for providing me this opportunity. I will stop sharing and over to Alok Bhai for further proceeding.
Vipul bhai, fabulous as usual, fantastic, lovely. And I really wonder what I think next year we will hold these webinars through AI only rather than being there. But I really like the way you presented AI in a very wholesome and a very a very complete format that you brought it out. I always say, as far as AI is concerned, AI can make you shake hands. So two agencies, a patient and doctor, can shake hands, and AI can do that handshake very beautifully. It can do it over countries and over distances, which two people cannot do. A patient and doctor physically cannot do. But AI cannot give you the warmth in the handshake. That only the doctor can give. So the handshake is there, but that warmth comes when the physical, input from a physician comes in. So now we come to the most interesting part of today's session, and that is a panel discussion. So I'm grateful that all the panelists are here, and we would take some questions from the faculty very soon. And before we do that, I would like to tell the audience, the delegates who are attending today, that this session is for you. So feel free to raise your hand and ask questions. I would allow you to open up, unmute yourself, and we can take questions from your live, because we have a very esteemed panel faculty here. I see a hand has come up from Dr. Ashok Shah. So I'm giving you the option to talk. So, sir, could you please go ahead and ask your query? Or you can also put it on the chat box. I can take it from there also. So, Dr. Ashok Shah, are you there? Since you have raised your hand. If not, then I'll go ahead and we'll. So, can I ask the faculties to please unmute themselves and keep their videos on? So, Dr. Subhashree and Dr. Ritu, can I ask you to do the honors, please? Yeah, Dr. Ashok Shah has come. Yeah, he's there. Sir, can we ask you to please go ahead and unmute yourself and ask your question, please? Dr. Subhashree, can we have you to please unmute yourself, and can you Can we see you present on the screen, please? I have Dr. Dimple, Dr. Neeraj, Dr. Rajendra Tiwari. You all can also participate. You all are most welcome. Yeah, Dr. Ashok, can we have the question from you, please? Yeah, please. Starting paralysis. Okay, I think he might be busy. So I'll go ahead and ask the first question to Dr. Subhashree. So, Dr. Subhashree, this question is for you. Now, we have a very aggressive and a very dynamic online branding going on, and you see a lot of medical practitioners and their agencies, especially corporate hospitals, being very aggressive in online branding. The question is very simple. If this is allowed and this is permitted, how can we do it with business success, but without appearing commercial and without crossing the line of ethics? I guess Dr. Subhashree is having probably some net issues. So let's go to Dr. Ritu. Dr. Ritu, are you there?
Yes,
Can
Dr.
we have
Alok.
you unmute yourself? Yeah.
Yes, Dr. Alok, I'm here.
So my question to you is teleconsultation, as you know, has grown very rapidly, right? We all are, a lot of patients ask us, and I've had patients who don't want to come to the clinic and wait, because he says there is a lamba line lagega, to main aake baithunga nahi. He's probably sitting
Right.
just five steps away in the next clinic or the next house, which is next to our clinic, and he says, "Why can't they connect with you, online? So let's do that." So my question is, teleconsultation has grown rapidly. But where exactly should you draw the line? And you should ask that, no, I will not do a virtual consultation. Please come down for a physical consultation.
So I would say that teleconsultation is definitely excellent. There is no doubt about it. But then, given the chances that there is going to be no opportunity to examine, if you feel that there is going to be physical examination mandatory for your diagnosis, or you may need an urgent intervention to make, you have some procedural assessment that you are looking at, or your diagnosis is not certain, without seeing the patient, then definitely yes, remote care is not the answer. Teleconsultation is not the answer. You have to ensure that you tell the patient that come down for this time, and next time probably the follow-up could be a teleconsultation as well. So definitely yes, if it comes to follow-up counseling, maybe a chronic review, that can be managed, but not situations where you have diagnostic uncertainty.
Okay. I just wanted to tell the audience that this has very strong legal implications.
Yes.
You need to know that if you can miss a diagnosis on teleconsultation, or if you give wrong treatment on teleconsultation, which would have not happened if you had done a physical, you are answerable. So feel free to draw the line and put a stop to it there and there only, whenever you are uncomfortable. That's very important. So Dr. Subhashree, welcome back. And we have a very interesting question for you. And this question is very simple. You know that there is a lot of aggressive online marketing, advertisement, branding going on. So, and you also know that we definitely want to use social media for our business growth, and we should use it, and why not? The question is, where should we draw the line so that we don't cross the line of ethics and we don't appear to be commercially driven rather than patient benefit driven? Any takes
I
on that?
feel thanks a lot for this question, Dr. Alok. I strongly feel that now the consumer, or rather the patients, have become very smart. They understand what is genuine, what is not. So we should not think that the people who are looking at us are absolute fools not to understand that this is just a marketing gimmick probably that we are playing. So I think the authenticity and of the content is what matters more. The idea behind giving the content in the social media should be more about education rather than promotion. If we make a genuine attempt, I'm sure the patient recognizes that this is a genuine attempt towards preventing the misinformation, because a lot of information is bombarded in social media by various people. Even some of the quacks are talking about things which I'm very sure they are not even aware about, and people get confused hearing this kind of information. So if it comes from a right source, right channel, and qualified people like us, I'm sure that marketing, that promotion will make the impact and will get the patient to us, to our OPD, to get the consultation from us.
Fantastic. Very true, actually. And I just wanted to share over here. I'll commit a little error of, being unethical here, but I'd like to share this. So I have around 7,000 followers on LinkedIn and around 9,000 followers on Facebook. And I see you guys, social handles, you guys do a phenomenal job. And I keep getting inspired by you guys. So, thanks to you guys, I start learning. And Dr. Ritu's social media handles are phenomenal. I need to see them and get inspired as to how to impart patient education. And I would like to share with you people that Dr. Mukesh Gupta is our past president, is an obstetric gynecologist practicing in Bandra area. He has given wonderful YouTube videos on Garbha Sanskar and patient education. And would you guys guess he's got 1.2 million followers on YouTube? We heard doctors getting so many followers. So, doctors have got a huge potential of being social media influencers, and we need to take that in mind. So, Dr. Vipul, the next question to you, I'm going to make you guys very miserable here. I'm sure you'll forget all your good words by the time I'm done over here. So, Dr. Vipul, the question to you is, most patients, they come in complain, जो मेरे साथ भी हो चुका है कि ये डॉक्टर जो कंप्यूटर देख देख के इलाज कर रहा है, वो सामने कंप्यूटर उनको सिखाता है. दिस इज ऑल स्क्रिप्टेड, जैसे you see these comedy shows and you see these movies, na, all those emotional and the romantic scenes are all supposed to be scripted, and you keep hearing stories of how those actors fight with each other miserably after doing a romantic scene. So patients come and tell us, these are all scripted things. आप जो दवाइयाँ ले रहे हैं वो scripted है, आप जो diagnosis दे रहे हैं वो scripted है. In fact, one of the patients, I was one of the early people in this game. So when I was using EHS, like I said, I was one of the early people. So one of my patients told my receptionist, ये डॉक्टर को क्या आता है, वो तो कंप्यूटर जो उसको बताते हैं वो ये लिखता है, इसको थोड़ी ना कुछ आता है, हम गलत डॉक्टर के पास आ गए. So you get such kind of answers. So what's your answer to that, Dr. Vipul?
So it's very important thing that doctor has to be very empathetic. Doctor has to be facing patient and talk to patient in with eye to eye contact. This is my observation also, that many clinicians just focus on data collection and entering the things in computer, and the most of the time they are not having eye contact with the patient. Of course, they are doing the best of the practice. They are following all the guidelines, but doctor patient relationship is something that is very different. With the help of AI, we can have the scribing part done by AI. So audio recording of consultation and it is translated or transcribed into a written mode is also available. Also, AI filter all the data and give you the final summary of what are the positive finding in the history, in the examination, in the laboratory report, and also filter down the possible counseling part or possible therapy that we have to explain the patient. So with the help of the AI, we can use the thing in a most important way, and we can doctor is not only data collector and the decision maker, but now doctor is a data collector, decision maker, as well as a proper counselor. Fortunately, in Ahmedabad, still we don't have that patient come and tell or talk to our staff that doctor is doing these things, only seeing in the computer and using the data from the computer. We are not facing such things that you are facing in Mumbai, so we are fortunate enough. But the time is not far away that this time will happen in Ahmedabad also. But before that time arrives, we will use the AI in a better way, and we will empower ourselves that we can talk more with the patient, and data collection part and data entry part will be taken care by the AI itself.
Thank you, Vipul bhai. That's true. And actually, I tell you the truth is, they say the beauty and brains. Yeah, Dr. Subhashree, please.
Yeah.
Please,
What I
please
feel
add.
is it is not only important to maintain our eye contact with the patient, but somewhere down the line, our touch is also important with them.
Exactly.
Whenever I make sure that, when I empathetic topic, as Dr. Vipul said, is going on, I make sure that sometimes I give them a tap on the back, or when I examine them, I hold their hand. When I'm assuring them, I hold their hand, and that creates a huge emotional impact. They can feel that you do care for them, and you have examined them not for just for the sake of examination, but with a genuinity that you care, you want to know, you want to diagnose them, you want to give them your best. And I think every effort towards our making our patient comfortable, no matter how technologically advanced we become, really makes a lot of difference to us.
Very, very, very rightly said, Dr. Subhashree. That's the essence of the whole thing. What you brought out is the basic essence of the whole communication, which has been going on for many years. I always say, we always read about it that beauty and brains don't coexist. So on the dais, it's a different scenario right now. But how can you find a better, more glamorous and a more beautiful and a very intelligent secretary at very cheap price for you? And that is AI that I'm talking about, taking care of all your work, while all you can sit and do is sip a nice cup of coffee or tea and have an eye-to-eye contact with the patient and look at him straight in the eye, console him, comfort him, give an empathy to him, whereas your entire work is done by the AI and you have to finalize the treatment and the diagnosis and the investigations and the plan of action. How can you have something better than that? So that's the phenomenal part of an AI tool. So going further, I guess there is some question from the audience. Okay. So Dr. Karthik Rao has put in a question here. Which ambient AI can be used in OPD? Does anybody know what is an ambient AI? No, don't tell me, Dr. Alok, you will be answering that question. I can see the smile on your
You will
faces.
be answering that question.
No, no, no. I heard this. What is ambient AI? Does anybody know? So basically, and trust me, I have not created it live. I just gave you that example. That itself is ambient AI, which is working quietly in the background. And this was asked by Dr. Karthik Rao. I think I have already answered it. Dr. Karthik Rao has again answered his own question for listening and documenting data. So fine. So we move ahead now. So now the next question to you, Dr. Subhashree, is let me see. I think this would be a very nice question. Uh, There are 3 points here, Dr. Subhashree. One is called as a reach, second is called engagement, and third is called credibility. Now, people who work on social media will tell you what is the importance of reach. So that means if you're able to, like I said, you have so many followers, if you're able to reach 1.5 or 2 million followers, it gives you your branding. Then how many of them actually get engaged and have a conversation with you or come to your clinic? And how many of you trust you because of your social media? So how should you balance your visibility and how do you create a reach and engagement and a credibility on social media?
First thing is, if we are planning to promote ourselves as a specialist, we have to give away the information which is more relevant to the people who are looking out for that kind of specialty. So our reach should be to the people who are looking out for a diabetes specialist, and we should be able to reach the relevant people who are likely to create a footfall in our clinic. That is the first thing. So our content should be created and curated in such a manner that it is authentic, it gives the right information, and it answers the questions which are very relevant for patients who are suffering from type 2 diabetes. That's my example. Then comes visibility. The visibility part. If our content is good, I'm sure the visibility increases even organically. Dr. Alok, we don't have to really work hard to do it. Gradually, the visibility increases. And when it comes to footfall, many of times what happens is they try to reach you, but if you feel that the communication while reaching to them is not that great, the person who is answering the phone calls, the person who is calling them for consultation, even that experience need to be taken care, because these days people notice each and everything. Even the person who, whenever they are calling the clinic, they are the person who is answering their questions, even that should be very good, formal, inviting, and then the patient probably drops by in the clinic, and that's where our whole effort towards creating a social media awareness comes to a culmination, because we are able to create a footfall to our clinic. So these days, patient wants these kind of experiences, and whatever they write on the social media creates a huge impact. So for us, our content needs to be carefully thought about on all these aspects and then put across so that it reaches the right audience and fetches us the results. And this is what, as a specialist, we need to create of our own. So it should not be somebody else who is guiding you, ki, हाँ, ये बना लो, but it should be us who should decide, because we are sitting here, we know what are the questions which our patients are likely to ask us. What are the points wherein there are going to be myths and facts about it. So these are some relevant topics we should choose for ourselves, and we should try to talk about them more often, and that will definitely bring benefits.
That's true. I'll just add 1 or 2 points over here. So for visibility, we need to understand something called as Google crawlers. So Google has its crawlers which actually start seeking out your positioning and your presence on the net and how active you are, and multiple factors are there which pushes up your level when somebody is searching for you, or like somebody is searching for the best diabetologist in Andheri. How far you come up at the top is where Google crawlers are responsible, and there are multiple factors like SEOs and all. So people who post very heavily on Facebook and Twitter and Insta don't necessarily get patients. Patients actually come at watching your Google My Business page. Very few people know how to work on the Google My Business page, and that's very important. So Dr. Vipul would be leaving early, so that's okay, Dr. Vipul. Please feel free and comfortable whenever you want to leave. So that increases your visibility, and I'm going to keep a talk only on SEOs and Google visibility on the social media handle. I'm going to keep a dedicated talk in the future. So watch this space. That is going to be important. There is another question here, and that goes for Dr. Ritu over here. And Dr. Ritu, this is a very important question which I want to ask you. People keep talking about teleconsultation, 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 and I've seen a lot of doctors do WhatsApp consultation. In fact, a lot of patients pressurize you and they tell you, why do you want to get a Zoom link and why do you want to use our platform? मैडम हम आपको फोन करते हैं, आप फोन पे जरा व्हाट्सएप पे अपना फोटो दिखाइए, अपना मुंह दिखाइए और आप बता दीजिए क्या करना है हमको. So what is the medico-legal vulnerabilities? Listen carefully. What are the medico-legal vulnerabilities? What are the Supreme Court, Honorable Supreme Court guidelines in teleconsultation? If you can just talk in brief in 3 or 4 points.
So clearly, I think if you're asking me in points, one is inadequate documentation, identity verification unclear, lack or insufficient consent, and over reliance on incomplete remote information. I think these are the 4 things that can lead you into a ditch. So which can be worked upon, and you can reduce by proper records, by clear communication, by ensuring that you have given adequate disclaimers, given the documented advice that you're also giving them back in terms of prescription, and of course timely referral whenever needed for an in-person consultation. That is how I would take this.
I would just add one thing. Very few people know this. I'd just like to add this, especially for the Maharashtra Medical Council people practicing in Maharashtra. Before you do teleconsultation, there is a teleconsultation guideline published by the government of India that's available on the net. Very few people have read it. I would encourage everybody to read that. Second thing is that you're supposed to attend a training session done by Maharashtra Medical Council and clear the exam and get certified. Till that time, if you're doing teleconsultation, it is illegal. Unfortunately, that is written in the law, but MMC has not yet started that. So when they started, please be aware that you have to compulsorily attend that and get certified that you have attended. Till that time, in the eyes of the court, you're not legally allowed a teleconsultation practitioner. Third thing is that very few people of us do that. Before you start the teleconsultation, you need to check the government ID of the patient, whether it's an Aadhaar card or PAN card. None of us do that. You need to ask the patient to flash it in front of the camera and make sure that it is the patient that you're teleconsulting. There have been a lot of cases that patient A books an appointment, but patient B does your consultation. So be careful because you would be answerable in the eyes of the law. None of us check the ID of the patient. It is important that you check the ID on the camera and you record it and keep a snapshot. Another important thing is very few people keep a recording of the teleconsultation. And that is the reason I do not like these platform teleconsultations, because what happens is the platforms cannot store the data because legally they are not supposed to for ethical reason, but you can store the data if you have your own platform or if you have your own link. So that's the reason I prefer to create my own link where I do the consultation. And of course, with the consent of the patient, I keep that data. That is allowed, but then a platform cannot keep. And you should keep a copy of your consultation because tomorrow, if there is a query after some 10 years, you need to have your data in your hands, exactly what you've done and what you've not done. So Dr. Vipul has left, so we'll come back to you, Dr. Subhashree. And this is another important question to you. Let me ask you this. This is quite good. Now, you know that there is a lot of misinformation on the social media. Now, a simple thing is, diabetes is totally, since you're practicing as a diabetologist, you'll agree with me, diabetes is totally reversible. नीम के पत्ते ले लो, पपीते का जूस ले लो, या हमने recently I saw that, एक बांस का ग्लास आता है, एक पर्टिकुलर बांस का ग्लास आता है, जो 500 रुपए का होता है, उसपे आप पानी भर के डालोगे, आपका डायबिटीज पूरी तरह रिवर्स हो जाएगा. Trust me, it works. And if you put 2 stones in your tea, those particular stones which you are supposed to buy at some $45 can reverse your diabetes totally. And trust me, मेरे पास educated class के लोग आते हैं from corporates who sit and argue with me and tell me कि सर इससे शुगर कम होता है तो आप ये SGLT2 क्यों दे रहे हो, GLP क्यों दे रहे हो? And when I tell them हम आपके हार्ट और किडनी के लिए भी बैठे हैं, उसको भी संभालना है. So the answer I get is हार्ट और किडनी के डॉक्टर अलग है, हमको आपको नहीं दिखाना है, वो जब होगा तो हम उनके डॉक्टर को दिखाएंगे, आप खाली डायबिटीज देखिए, आप शुगर कंट्रोल करिए, काफी है। अनदर मेलेडी, nutritionists prepared trained doctors, I mean patients, I'll say doctors, gym enthusiasts, gym trained doctors and patients, like they have been trained by the gym trainers, and they come with those social media handles and all that, and they start teaching you what is the diet, what is the exercise to be done, and why insulin is a total no brainer. So how do you handle these social media posts, Dr. Subhashree, without getting into an argument with the patient and putting your point forward because you're scientifically correct and they are scientifically incorrect?
Absolutely. And I feel that the first thing that we need to do, all of us, is not to react to them emotionally, but take them, uh, give them an answer which is scientifically correct. That is what we can do. But I think the social media fights, as per the NMC guidelines, also they strongly discourage it. So, as per the guidelines, also on social media, arguing or personally pulling up names and may not be a good thing, and that would not reflect back upon you as a very good professional. So that should be completely avoided. We should stop in indulging in answering everything that is coming on the social media because it is practically impossible. As diabetologists, we are fighting with a huge cadre of people who are trying to promote Ayurveda, homeopathic. There are n number of quack remedies which are available. It is impossible for us to be fighting each one of them and answering every question that is propping up. So we have to just treat them where it is relevant. We should try to answer scientifically, and where we feel that it is not going to lead anywhere, we should just stop doing that. Because at the end of the day, this fight is not our own fight, our fight as a one person. It's a fight of the whole community, and we will need a long-term, regular basis efforts for things to change in our country, and that's going to take a huge, long time to happen. But I'm very optimistic.
Absolutely true, very right. That's what we have learned in our undergraduate days. Sometimes masterly inactivity is the best activity one can do, and one should know how to be masterly inactive. So, Dr. Ritu, I come to you with a very pointed and a very burning topic and a very burning question, which all of us face, and I'm sure all of you also must be facing this is there are people who, in spite of your best of efforts, put some very nasty and negative comments on your Google review. And Google is known for not removing those reviews unless there is a court order. So how do you respond to those? Like, for example, I'm not saying this, but let's take Dr. Alok Modi or Dr. Ritu, and suppose I find a review saying Dr. Ritu is not a qualified diabetologist. She's more of a social media enthusiast. She's a social media influencer. Please do not go to her. She's just going to, act like a salesman for you to do certain things and not give you the medicines which are required. I highly disrecommend this doctor. Like one of them wrote a review for me saying that I was trying to tell him about CGM. He said, ये कोई तो machine चिपकाने का try कर रहा है जो costly आती है. He doesn't believe in getting the sugar done from the lab, but he wants to check your sugar throughout the day. This doctor does not know his medicine. He does not know how to interpret one sugar value. He wants multiple sugar values, so he's not efficient. So not recommended. So, you get such kind of reviews. So how do you respond to that? I mean, I want an answer different from what Dr. Subhashree gave.
Absolutely. So I think, thank you, Dr. Alok, for giving me that, because I was just hoping that, I could add some bit. And of course, each one of us brings in our flavor when we talk to patients. And I would still stick to one line which Dr. Subhashree mentioned, that all we can do is be scientifically backed up. And, today we have plethora of people talking science, and a plethora of examples of quacks hitting on doctors, saying that, why do you stop me when you can't do the job which I'm doing today? And it's only disheartening to read those. So clearly, from my perspective, I have a very good strategy. I always ensure that whatever information I feel is of relevance of the patient, I make my videos for that. And when the patient comes to me with their relevant questions, I answer them accordingly. Now, I do also tell them that, see, this is always better that whenever you're following anybody on social media, be it a doctor, be it a social enthusiast, a social media influencer with no scientific background, always ensure that you double cross check that. So, because this is your health we're talking about, it's not only cosmetic, it is more to do with your well being, which is way beyond just, a casual approach over the phone. And secondly, like you said, if there are some people who are targeting us on social media saying that, this is what it is, and bad mouthing us, I would still would say that, as clearly, as science says to us, that everything is evidence based. We should remember that as while the Google map, the Google review is very important for us, and it makes a lot of difference when one person quotes that. But also remember, the patients are also seeing the rest of the n number of good reviews that are being posted there. I would always request people to not write back anything there. Rather, try to either understand if the patient is in touch with you, to know and close the issue through your staff or through your designated social media handlers, so that your team knows how, what kind of languages to be used, what kind of questions are to be asked, and what kind of answers are to be given to them to satisfy their, or to actually answer their queries, because of which they have stemmed up and given up that kind of a review. And there have been times, so like I said, there have been times that these kind of things have happened in the past with us also, but they have been very well managed through our team. So it's all about how you smartly handle them, rather than trying to get into a tiff with them online, because then it becomes more of an ego issue or display on the social media. So be smart, be wise, and I'm sure the patients trust you. The patients do understand when they come to you, they understand. So I think you are definitely at a better edge than anybody else sitting remotely and just sitting behind the hashtags, or trying to blame you or defame you.
No, I have seen myself, most of the time these reviews are written by people who are not your patients. So I have a fantastic system. I personally write over there. Unfortunately, this patient is not found in the patient record. I don't think this is a patient. This is the person who has a right to write a review. That puts a stop to that. And sometimes I get an answer saying, I'm so and so of this patient, and this patient had a bad experience, so I have all rights to write. So I do write back, let the patient write. I don't think you should be writing. Anyway, coming to you, Dr. Subhashree, a very basic and a fundamental question. We talk so much about social media, social media, social media, and business is important. In your own experience, has social media fetched your patients? Do you
Yes.
really think that social media can increase your practice? And if it does, by how much percentage? 10%, 20%, 50%, or 100%?
See, I think I have started using social media pretty late in my practice. I should have used it prior probably. So I will not say that my practice is coming all of it through social media or it has a good percentage, but I do feel that at least 20 to 30% of the footfall has increased after using social media. A proper person who is handling my SEO, Google reviews, everything. So we get professional help, and we are able to manage our reviews, our social media presence, our pages properly. We do get patients who come through them. And that is, and I personally, I'm saying this out of my own experience, and there are many others who will vouch for it and say that definitely the patients do turn up. Because somewhere down the line, they are also on the lookout of good doctors. If you have touched upon them, you have given them authentic, right information, somewhere you have touched upon. Once they come to our clinic, that is only the step one. After that, ultimately, it is our skill, our communication, our professionalism, which is going to maintain and create a follow-up basis on that first footfall. That first footfall is important, and that's why social media is important. Footfall that has to come to your clinic. And that's why, even if I would say that the result is 10% or 20% by using social media, that your practice is increasing, even that 20% matters. Because the 20% may invite another 20-30% by their word of mouth and things. So I think in every way, social media does help. So even
So
if
now
we
I have
are not able
understood.
to invest that much of time, we can hire people, as Dr. Ritu said, who will help us. We can have a team who can create a good SEO, create a relevant content for us, and make sure that we reach our patients on a regular basis.
So now I know whom to meet and approach if I want to improve my social media presence. So I hope you keep your neck peak free, because I need to come and take some classes from both of you. Now, this question is to both of you. Very simple question. I have suffered, so I'm asking you this question. Very simple question. Should your social media marketing and handles be handled by a professional, or should you people handle it, or should it be like a hybrid? Both of you handle it. Which do you think is the best approach?
Hybrid is the best model, because you cannot let any content go without your supervision. Ultimately, it is going to reflect us, our
But then you
personality,
would
our
not have
vision.
the time. You would not have the time and energy to sit and do the SEOs and the algorithm works. So those are handled by
Exactly. So,
professionals.
of
So
course,
no,
but
one second.
whatever
So
content,
Dr. Subhash, let me ask you: do you handle 90% of his work yourself, or do you give 90% of your work to professionals? How does it work with you?
Yeah, see, I'll explain you how this works with me, because I have had increased my practice during COVID times much more, where people were approaching internet for looking out for doctors who are available around, and many of the senior doctors were not practicing at that moment. Therein the practice really picked up at that time. So what happens is, at that moment when the need is created, we need to ensure that we cater to that need in a proper way. So during that time, when the social media handlers and the team which I created for my SEO started working towards it, I made sure that every content which they are putting out over there is more relevant. Secondly, supervised by me, and at times used to also create videos which are more relevant depending upon what the situation is. So when we are doing this, we cannot let that content go absolutely unsupervised. As you correctly said, एसईओ बिल्टअप करने के लिए, प्रोबेबली उसका अच्छे से मार्केटिंग करने के लिए या पेज क्रिएट करने के लिए हमें लोगों की जरूरत है, लेकिन पेज के कंटेंट को सुपरवाइज तो हमें ही करना पड़ेगा. देयर इज नो अदर वे दैट समबडी एल्स इज putting it on our behalf. That cannot happen, because if that is happening and something wrong goes up, ultimately the whole brunt is going to come back to the practicing doctor only, and it's our face, our image which is at stake. तो वो अच्छा होना, उसका क्वालिटी अच्छा होना, उसका साइंटिफिकली रेलेवेंट होना, इट्स आवर रिस्पांसिबिलिटी ओनली.
Very true, very rightly answered. Fantastic. Your take, Dr. Ritu, on the same question?
So I think quite similar to this, but then I feel I also want to add up that, every patient today searches for your digital footprint. Every time they see a new doctor, they want to go ahead and they want to search you either on Insta or Facebook. And therefore, anything and everything, like Subhashree said, you are posting is actually what is, the content about you. So it has to be supervised. It has to be everything that is flavored, that is in favor of what you want them to look at as. Otherwise, it's definitely not going to be playing in your favor, and it's not going to be the fair distribution of dissemination of information as well. So clearly, for us also, it is simple that we ensure that all the work which is technical, where we probably do not have the expertise, like the SEO handling, or if it is, the websites or the entries or the software aspects, then those are the things that are handled by the team. But when it comes to the content, which is, how it's going to look, even the editing, after the editing also, the video has to be looked upon by the doctors, because sometimes it's very funny if they edit it in a wrong fashion. Even if a single word is missed of what you're talking, the entire meaning of the concept can change. Your advice can completely go awry. And therefore, a complete end-to-end supervision quality check should be in place at multiple levels in terms of content development and supervision and upload.
Fabulous. So I think we're nearing the end of today's session. So I'll take one or two last questions and close it. And can I request Dr. Rajendra Tiwari, Dr. Dimples Shastri, and Dr. Supriya to kindly unmute yourselves and show us your lovely faces. So I would like to ask you guys also to participate if you people are physically around near your laptop. So one very basic question, Dr. Ritu, in this world of AI and social media and everything, I'll come to Dr. Subhashree first. Where do you find yourself, Dr. Subhashree, 5 years from now? Any takes about the future?
Is I want a consistent growth. That is what is my ambition. I want to ensure that I'm doing better and I'm not competing with anybody else, but I'm becoming better than what I was probably 5
You
years
missed the
back.
question. I didn't ask that question. I'm asking you, in this era of social media, digitalization, and AI, where do you find yourself and medical practice 5 years from now? Relevant to AI, social media, and digitalization.
Oh. So when it comes to social media, see, Dr. Alok, social media is going to give a lot of options and to the patients, because there's going to be a big basket that they're looking out. There are so many people who are going to put out their content over there for them to understand and judge for themselves where they want to go. So the situation is going to become super competitive gradually. And who is relevant, who is irrelevant, who is qualified, who is not much qualified. It's going to be a very thin line between it, because ultimately the social media reviews, the presence, and the how you put out, ultimately that is where people are going to judge you. So what I feel
I was thinking you would say that I'll find a virtual Dr. Subhashree sitting and talking with patients and us, and the real Subhashree would be out on the beach with her husband,
No,
having
no,
a
I
good
cannot.
time.
I can never do that. The reason is because unless I talk to patients, even I cannot survive without it.
So that's
They
the
are
real
as much
answer.
part
I'm
of
very
my life as much they need me, even I need them. It's something like that. So we are totally into each other. I have to
so
see those number of people, talk to them, and feel good. That also makes me feel good about myself. So that would never happen with me, at least.
so I'm very happy.
एकदम
So
छान
guys,
दिसतात. घडवून आले मस्त.
this is the answer we were looking at. So Dr. Subhashree has answered very rightly. She is a true doctor, and she would like to remain a true doctor even 5 years from now. I'm coming to you, Dr. Supriya. Dr. Ritu, your answer to that. 5 years from now, where would you be? And don't say that I would like to be there like Dr. Subhashree. I want a different answer.
So Subhashree gets the first mover advantage. But I would definitely want to say that, kudos for laying the platform for me. I think that, 5 years from now, clearly I see better patient outcomes. That's what I see, because the compliance goes 10x, the adherence to medicines, the adherence, the belief in the doctors goes 10x. I mean, I'm just using the numbers without any statistics right now. But as I showed you, there's already evidence that backs up that beyond standard of care. See, what we are doing is standard of care, like Subhashree said, when we are talking to the patient. That is the essence of the patient getting the treatment, you diagnosing, the patient talking and understanding. But beyond the walls of your clinic, the patient, when they go back home, there's a lot that they want to connect about. Sometimes the 3 months that they're calling you, they're visiting you back in, there may be times they want to get in touch with you even more frequently. And that's where these virtual teleconsultations or the AI helps, the chatbots, the medical apps would be really helping them in terms of your food calorie counting, in terms of your reviews, in terms of understanding the disease even more. So understanding when smaller symptoms are really not small, or when what they perceive as big symptoms are really not that grave. So I think that is where 5 years from now, the medical care will be so good that patients will be able to understand the difference between the standard of care and the AI requirement of bridging these gaps, thereby resulting in better patient outcomes and better productivity, therefore better economy of our country. I hope it was different.
That was phenomenal. That was phenomenal. Any takes from Dr. Rajendra Tiwari, Dr. Dimple, and Dr. Supriya? Okay, I think they're busy with their AI clones. So I think I would like to thank the esteemed faculty, Dr. Subhashree and Dr. Ritu. As usual, you people have really done a fantastic job as always. I actually wonder how do you guys drive so much of energy? You guys are so active and dynamic. You need to teach me some lessons on how to get so energetic. People are full of energy, do a fantastic job. Thank you very much for gracing the occasion at a short notice. I'm really grateful to both of you. I would like to be very grateful to our president also, but I think I'm doing the vote of thanks, which is not my job. I should not do that. So I'll pass it on to Dr. Dimple. Dr. Dimple is a very renowned psychiatrist who's a part of our managing committee. Madam is somebody who's very wonderful and very attentive, and she contributes a lot to the growth of AMC. So, ma'am, over to you. Could you do the honors of doing the vote of thanks, please?
Good evening, everyone. After the wonderful session, I would like to conclude that now we are entering into an era of a new healthcare, one where technology and clinical experience goes hand in hand. But our clinical judgment, our compassion, and the patient connection are irreplaceable. Technology serves best when guided by our experience and ethical practice. Here, I would like to thank our President, Sir, Dr. Rajendra Nagarkatti, our Honorary Secretary, Dr. Alok Modi, and the entire AMC team, and above all the speakers for their wonderful presentation. Thank you.
Thank you, Dimple, Dr. Dimple, for being there at the last moment. As usual, you're always very helpful. And I wish, can I have one liner from you on AI and psychosocial health? Something to add spice to the whole game.
Okay. This I can just give you an example, a very small patient thing. where a patient was abroad, and the patient came to me, and they said that he was on antipsychotic, but the patient, they somehow could not connect with us because of the time gap, and he asked the AI, ChatGPT, how am I supposed to react when my son behaves this or my son talks this? So that is the thing with AI. But when he came to us, as I said, that our judgment, our compassion, and I think so Dr. Ritu and everyone said that our personal touch, our patient connection, it makes a lot of difference. And irrespective of AI, I think so doctors are going to be doctors forever.
Thank you. That was sweet.
Yeah, thank
Dr.
you.
Subhashree, I won't pardon if you're going to take that coffee single alone without sharing with all of us. The least you can do is pass it on internet pathways. Otherwise, I'm not going to say thank you to you. So that's very sweet. So thank you all you lovely ladies. I'm surrounded by all the ladies here, and I don't know what to say, but thank you very much, all you graciously beautiful, intelligent, top of the line and highly dedicated medical practitioner ladies. I'm really grateful to all of you. And before I conclude, a lot of thanks to our honorable trustees and seniors and AMC who has made AMC where it is today. Our highly respected President, Dr. Rajendra Nagarkatti, and all the repertoires, including Dr. Dimple, for taking our time and spending your entire afternoon for today's session. Thank you very much. And before I conclude, I will do the last job for today, which is a very important job. All of you who are listening to this, please don't forget these two gentlemen. Don't forget to vote, because Maharashtra Medical Council should be your council. It is your vote that counts. You are the one who would be deciding the future. Dr. Prashant Kirkar, Dr. Nilesh Nafre are standing on behalf of AMC. Please do not forget them. Please give them your support. And I hope we all come out on Saturday and cast a valuable vote on that day. With that, I close today's session. Thank you once again, everybody. Have a great day, have a great week, and a great weekend. Bye-bye. Good day. See you.
Thank you, Dr. everyone. Thank you.
And all of them have to sponsor a coffee for me the entire month. Thank you. Take care. Bye-bye.
Thank
Bye
you.
bye.
Bye,
Bye,
thank
Ritu.
you.
Bye.
Bye,
Yeah, bye.
everyone.
Thank you.
Bye, ma'am.
Bye, Dr.
Bye.
Dimple. Take care.
Bye.